Okay, couple of things for today. We'll start with introductions. And then I'm gonna we'll make a kind of an announcement that Erin has been working with all of our presenters to stay on time with all of our presentations. We as the board really felt like that was important to stay on tap better. One of the things that we'd like to do moving forward is have lunches where we get the opportunity of board members to interact with folks that are at our meetings. We felt that it was important that we get to know the people that work at the board and the folks that travel to attend our meetings. So please feel free during lunch to interact with us and introduce yourselves if we haven't met any of you. And on top of that, we have 2 new board members that we're really excited about. They'll be great additions, and I think they deserve an opportunity to get to know all of you folks as well. So to start with, I'm Veronica Sawatzke, turkey producer and chair of the board.
Where do you want to go?
We'll go with you.
I'm a livestock veterinarian out of Northfield, Minnesota. What I really know is pigs, but I've learned a lot about poultry lately. And I'm really happy to be on the board. Been here for 3 years now. 4 years.
I'm Steve Neal. I'm also from Northfield, and I'm a cattle producer.
I'm Brandon Schaefer, multi-generational farmer from Goodhue. The focus, I use primarily pigs and beef cattle. So glad to be here.
I'm Heather Damico. I'm a senior veterinarian in charge of servants, horses, and sheep-dogs.
Veronica Bartsch. I also am a senior veterinarian. I oversee companion animals, rabies, and biologics.
I'm Shauna Voss. I'm a senior veterinarian in charge of poultry programs at the board located on in Wilmer, Minnesota.
I'm Crystal Lattenslunder. I work under Dr. Voss with Poultry and located at the NPTO.
I'm Dave Galligan. I'm a outreach specialist with the board.
I'm Karen Prater. I'm the communications specialist at the board.
I'm Melissa Smith-Jansen. I'm the business manager for the board, so I'm in charge of HR and finance.
Morning, everyone. I'm Lisa Woods. I am the HR technician at the board. It's started in July. Excited to be here.
I'm Courtney Mueller, assistant director in charge of field operations.
Hi, everyone. I'm Shauna. I serve as director of government relations for the Minnesota Farm Agriculture and the board now.
Eric Chop, assistant director, I'll oversee the senior veterinarians.
Katie Cornille, senior veterinarian, and I oversee bovine traceability and livestock concentration points.
Brian Dees, executive director and of the Board of Animal Health and Minnesota State Veterinary.
Rovira, interim director of the Veterinary Diagnostic Laboratory at the University of Minnesota.
I'm Margaret Kanzuri, I'm the new pathologist, food animal pathologist at the Diagnostic Lab.
Alex Staley, cattle producer, member of the Shauna and Sioux community.
Jessica Fox, board member and veterinarian in Southwest Minnesota.
This is that. My water compliance and supervisor, compliance across all programs.
And I'm John King. I'm a veterinarian, field veterinarian, new to the board in July.
Thank you, everybody. Is there an approval for the minutes from our April meeting or a motion to approve the minutes?
I make a motion to approve the minutes from the April meeting.
Second.
There's been a motion and a second to approve the agenda the minutes from April. Any discussion? Any discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. Is there a motion to approve the agenda for today?
I so move.
All right, is there a second?
I'll second.
There's been a motion and a second to approve the agenda for today. Any discussion? Any discussion? All in favor, say aye. Aye. Opposed, same sign. Motion carries. All right, Brian, you are.
Just want to make an announcement for our presenters. Please use the microphone today to help our online people hear better. And this is good. This is not good. So thank you for your attention.
In addition, I forgot to mention that Erin, I think all of our presenters are aware, but Erin does have signs that she'll hold up as warnings. That your time is almost over, so watch Erin.
We're all set.
All right, I just told Aaron I'm real nervous about that because I can get a little angry, so I'll be the first one to violate the the time. So, all right, brief update on the activities at the board. I tried to make this kind of a chronologic on things that have happened since the last board meeting. So first thing I wanted to talk about is our staffing. I think I mentioned this at the spring meeting that we are really making some inroads and accomplishing getting our staff fully on board. So this is just to demonstrate who's new to the board since the last meeting. So Missy Sidigny is our emergency coordinator. She works with our FADD, so foreign animal disease diagnosticians, on investigating foreign animal diseases, as well as helping with our incident management team, the emergency response of the agency. Dan McCallahan is our communication specialist, helping Michael and Aaron with communications at the board. Jean Rothwork is our accounting officer. She replaced Maria Glidden that retired earlier this year. Lisa Lutz is our HR technician, keeping us online and on track with getting our performance reviews and position descriptions and all those supervisory kinds of things in order. Caitlin Chapman is our new OSAI for bovine and animal disease traceability. New field veterinarians, Dr. John King introduced himself earlier. We have Dr. Bonnie Miller as well. And then starting next week will be Dr. Kate Brakefield. A couple of pending positions. We are still working on our general counsel position. That is in the approval process, correct, Melissa? And then we also are looking for an OASI for the CERTIC program. Yes.
Sorry, what is OA?
Oh, I'm sorry. Oh, I hate when people do that. So OASI, Office Administrative Specialist Intermediate.
Thank you.
Sorry. Thanks for asking that. Staffing changes. So I also wanted to point out that we have some individuals that have changed roles within the board. So Dr. Damico introduced herself. Dr. Damico used to be one of our field veterinarians and moved into a senior veterinary position. Sam Capel used to be with the Cervid program and moved into a position with the cattle program. And then yours truly moved from senior veterinarian to interim executive director to executive director and state veterinarian. Another activity that Dr. Jock and Maya and I were able to attend earlier this year was tribal relations training up in Red Lake. It was our goal to have a tribal liaison for the board. That was some funding that was not approved by the legislature. So we're doing some things to kind of alleviate that gap in our agency. So we currently contract with the Department of Ag to utilize their tribal liaison, but we're also trying to get some internal training. So I just wanted to point out that we were able to spend a couple of days at the Red Lake Nation, learning a little bit more about their culture, about their activities, some things specifically related to our agency. They have bison herd that they've recently introduced and are expanding. They've got a really unique agricultural program up there where they're trying to supply food for their schools. So all of their fresh produce goes to support the schools. We learned about their walleye reintroduction on Red Lake, as well as the elk and their connection with the elk relocation that is occurring with the Fond du Lac tribe. Besides all that, we were learning about how relations with the tribes works as well. So a big part of this, so I'm mentioning all the things that are directly related. Indirectly, it's just the relationship building that we were trying to establish with the tribes and maintain communication. That was kind of the theme that we recognized, that they just want to be part of the conversation, and sometimes they're the main part of the conversation. I won't get into some of the discussion about the elk relocation, but that was an interesting topic for sure. Next, transfer of farm whitetail deer to the DNR. So this was a bill that was passed. Effectively, the transfer was scheduled for July 1st. In reality, that transfer is ongoing. So as of July 1st, there were still a lot of unknowns, a lot of questions that we ironed out. I have to give kudos to Addie, who's been kind of the stable one in our circuit program. She's there helping us with that transfer. She's also helping the DNR with the records and how those things work. Part of the transfer included an interagency agreement, so an agreement on what duties were shared, what duties were specific to one agency or the other. Dr. Wheeler was the one that initiated the first draft of that, and then transferred it over to the DNR, basically adopted our draft, and we signed that. We'll do a review within 90 days just to determine if the transfer is working, if the interagency agreement is still amicable, and more to come on that. New board members happened this summer as well. We already met Brian Schaefer, Steve Neal, welcome aboard. I also wanted to mention the legislation that approved a companion animal veterinarian to be appointed to the board as well. So Michelle will have a little more information on that, where that's at. To be determined. We don't have, I don't think it's gone live yet, Michelle, on the Secretary of State's website, but we've been getting some emails to them and inquiries and questions about when that can be expected. We're hoping by the end of this year, certainly prior to the next legislative session. Then later this summer, I was involved in our US SHIP House of Delegates along with Brandon. We were able to meet again in Minnesota. I just wanted to highlight some of the changes that were voted on at that meeting. So US SHIP Swine Health Improvement Program, standards and amendments to standards that were passed. There's some changes to the voting process. How many are, what percentage is required for something to pass? Basically, standards and amendments require a supermajority, which means 2/3 vote. Resolutions require a simple majority, so 51%. Clarification of minimal requirements for movement records. This specifically related to including numbers of swine or semen doses on a movement certificate. And then incorporating the current USDA African swine fever, classical swine fever active surveillance program. So currently there's already active surveillance going on. We have different numbers that are assigned to each state based on their swine populations. The standard that was voted in was to include that into the actual testing protocols that will be part of US SHIP. And then resolutions, those suggestions or those ideas that were asked to get further discussion, further investigation into. Further assessment of repositories for movement records. So there's been discussion about having all movement records in one central location where all state veterinarians or other interested agencies would have access to them. Integration of a feral swine pig mitigation plan in the biosecurity plan. So not an issue in this neck of the woods as much as our southern states, but it's been requested that is added, that sites that have this issue where swine are in close proximity to feral swine have something in place to identify how they're keeping them separate. Establishment of an exhibition swine working group. So right now, that's one of our categories that is very underrepresented in the swine industry, and it's a group that travels a lot. So we're very interested in having them on board and being able to track them and potential disease spread in this group. Exploration of a site status verification database. This specifically is to allow things to be in a common repository where state animal health officials, other US SHIP official state agencies are able to go in and determine if if a pin assigned to a premise is US ship certified. This one came with, this was actually a standard that got turned into a resolution because in Minnesota, we actually have an issue with that. PIN numbers are considered private, non-public information. Other states, that's not the case. So Minnesota was the fly in the ointment on that one to try to determine a better route, find out what the information would be used for. So not a standard, but more investigations on how we can establish that, or if we should establish that. And then just more discussion about the process around the ASF/CSF active surveillance program, how we incorporate that, but also how do we increase that? How do we apply that to US ship standards? Recently, so this is another legislative kind of action, but this just came across my email here in the last week or two, feral swine and mink report. So we've been charged to work on a report with the DNR, Department of Agriculture and USDA Wildlife Services to determine how Minnesota approaches feral swine and mink in the state. So currently, mink aren't under anyone's jurisdiction. They're kind of a voluntary industry in the state as far as being registered or regulated. Certainly feral swine is of concern to all of us. So we're charged with writing a report on how we're going to approach this. The DNR is heading up the initial draft, and then we will all have an opportunity to edit and compose the final draft that will be presented collectively to the legislature. And then I wanted to mention our USAHA convention coming up in October. So the United States Animal Health Association. This will include the National Assembly, which is all the state veterinarians that make up the board of directors. And then we're also going to be sending all of our senior veterinarians to that conference. It's just a great networking opportunity. It's an opportunity to vote on resolutions that will also be submitted to USDA for consideration in legislation, regulations, and so forth. And that's my last slide. Do I get to ask a question, or do I need to look to see the question? Sorry.
Any questions for Brian?
I have a, go ahead, no, you go ahead.
So in you moving into the state vet position, what does your previous position with the swine program look like?
So that is going to transition to Dr. Job.
Okay.
And my problem is I don't do things like that quickly. So I've been kind of easing Dr. Job into that, but that will be, the plan was to wait until we were beyond the US SHIP House of Delegates meeting and then transition after that. So that's the plan.
It won't be sitting empty.
No.
That's good. Thank you.
I got a similar question.
All right.
Any questions? Thank you, Brian.
Thank you.
Wow, looks like you're not.
Hi everyone, I'm Shauna Medina. I'm here with the director of the Board of Animal Health and also the Department of Ag. Currently the Toronto hosting, if you're familiar with the role in this one. That's a topic for another day. So
Can you slow down?
oh, sorry, yes, sorry. So first I'll start with the federal shutdown. I know that's something looming over kind of everyone here, and we have concerns for Department of Ag, Board of Animal Health, and of course our farmers. If we have to shut down, that means no payments coming to farmers for some of our different programs, such as dairy coverage is one big one, and then just other support for farmers as well. Okay, at the moment, we kind of have our funding figured out. Department of Ag also, we're not fully sure, we're still looking into it because we have a lot of federal inspectors that do inspection and different things as well, so. I know the state government as a whole is working together to kind of figure out what are the impacts, what could happen. So we're meeting across the entire agency to figure out what we're doing, what we did going forward and how we can manage all of this. So still a lot of questions. We don't know what's happening. Also too, the farm bill is in the middle of this, so we're still waiting on the farm bill. We're hoping for an extension. Again, we just don't know what's gonna happen, and it doesn't look like it's likely to happen, in the near future, but hopefully something will come out. So that's kind of a federal update on that. And as Brandon mentioned, we are looking at the 2024 legislative session that's coming up here sooner than expected. I feel like we just finished, not that long ago, this last session, which was a pretty busy one. And this next session is going to be a policy session. So it'll be primarily based on policy. So we're looking at updating some of our policies that maybe have been a little out of date or needing some changes to. Also looking at the obsolete rules or obsolete statutes. Again, getting stuff updated in line. A lot of stuff has changed and some to put into legislation. Also, there's probably going to be supplemental budget as well for next session. We don't know how much yet. We're still waiting for the November and then also the February forecast. That will be little information for us to see what's available. I will mention, I know last year, most agencies didn't request enough money for their operating adjustment because we found out that contracts that came in at a higher percentage. So I know for sure we're looking at increasing that for the board to maintain our staffing levels and service levels as well. And that's same for the Department of Agriculture as well. This is kind of the cross-country agency kind of concerns, mostly, not all. I heard some in there a bit. So looking at that, so hoping there'll be somebody there again. We don't know how much, but we'll work on that going forward. Again, February 12th is the start date for the next session. So also the new board member, the community animal veterinarian, I reached out to the governor's office back in July requesting that what's get updated. I know say you're in the wrong position, so I'm working on getting all that corrected and get that position open because we do need that filled before the next legislative session. So we got a little time yet. I'm going to ping them again in a couple more days because I pinged them less than a week ago. So I'm going to just kind of keep pushing that, but we'll get that updated with the Secretary of State for sure. I think that's mostly what I have. Are there any questions about session and kind of federal government, anything else you're going to go maybe last session?
Well, I guess my question is there any way that we can help all of ourselves, Department of Ag and Board of Animal Health? What kind of communications with our legislators is appropriate? And talking to people and trying to, I mean, my legislator knows I'm on the Board of Animal Health, but I haven't really sat down and talked to her about what we're actually doing or anything she really needs to know. I guess talking points is what I'm looking for.
Yeah, I think we can work on that because there's some issues that as a private citizen you talk about differently than if you're the board member. So we should definitely talk about that and how we want to mess up. We haven't put talking points together, but we definitely can. I think that would be a good meeting for us with the board members and myself and the leadership of the board of how do you want to be involved? Do you want to come to committee? Do you want to testify? Do you want to be in touch with the legislator? Do you want to touch with the committee members of the Department of Ag, that way, of the Senate and House bank committees? So I think it depends on how much you want to, how much you want to be involved. So we can definitely work on some talking points of different things as well. We haven't in the past, but we can definitely look into that.
Any other questions for Shauna? Great, thanks for your update.
Okay, thanks guys.
Hey.
It's actually going to be Dr. Reberg is filling in for her today. She should be remote here. Dr. Reberg, are you here?
Hello, can you hear me now?
Yes.
Okay. My computer has a lot of issues with Teams. Okay, so I'm using my phone. Hopefully it hangs in there. I am not Dr. Schaefbauer. She does extend her apologies for missing the meeting today. She's at a tribal emergency management meeting in northern Minnesota yesterday and today. So Thank you, Chair Sawatzke and board members for inviting us to give this USDA update. Erin, I can't see if you have the PowerPoint.
Yeah,
So-
do you want me to share it for you?
Oh, sure, sorry.
Okay, just give me a second.
That's
Can
mine.
you see it?
That's mine for this afternoon. Hang on.
Oh, sorry.
You guys are lucky and get me twice today.
Here we go.
Alrighty. So you can go to the next slide, please. So I just have a few key things to update you on today. We're gearing up for the NAMS, which is the National Animal Health Monitoring Survey sheep study for 2024. Dr. Amanda Doran and I will be co-coordinating this study moving forward. And then I'll give a little update about our scrapie surveillance program here in Minnesota and nationally, and a ever-present hiring update for USDA. Next slide, please. So what are NAM studies? We get really excited about doing these every year. They take many years to plan, implement, and analyze. These studies are designed in collaboration with industry stakeholders. We try to identify their key concerns, how policy should be implemented moving forward, and things like that. The most important things are that NAM studies are voluntary and confidential. Producers have a lot of concerns about the confidentiality of the studies, and USDA respects that and works very hard to keep any information collected confidential. States are selected to participate in the studies based on the relative population of the commodity being studied across the US. And then the goals of the study are to collect and analyze animal health data about certain commodities or certain commodity sections. We ask lots of questions about general herd management, biosecurity, and then non-regulatory diseases that they're seeing and dealing with on their farms. Next slide, please. So this is a busy slide showing kind of the progression of NAM studies over the past 30-ish years. So the studies started in 1990. The very first study was a pig study. And then there's no set number of years where we study commodities. It's sort of on a needed basis. But the most recent studies have been swine and feedlot, goat, and bison. And Minnesota participates in most of these just because of the nature of our diverse agriculture practices across the state. And the upcoming sheep study we will definitely be a part of. We have a healthy sheep population here in Minnesota. Next slide, please. So like I said, NAM studies are several years in the making. First of all, we perform a needs assessment. Do we need to study a certain commodity? Is there a certain section of that commodity, like large scale producers, small scale producers, feedlot, cow calf, things like that, that would benefit the most from a study? So needs assessments are currently happening for poultry and equine. And then we're currently working on the sheep study, which will be rolled out in 2024. So many revisions, stakeholder input, producer concerns go into creating these extensive questionnaires that we administer to producers. Our field staff are all utilized. They travel all over the state to meet with producers to gather this really important information. All of that information goes into data collection. It gets submitted to the national NOMS staff, and they spend endless hours entering data, analyzing data, determining trends, and assessing producer concerns, areas where information or policy might be lacking, but there is definitely a need for it. So that's where we're at with goat, swine, and feedlot studies that have happened recently. And then everything happens at the speed of government. So reporting does take several years, but that information that comes out of those studies is really important in shaping policy moving forward for those commodity groups. Next slide, please. So like I said, Dr. Amanda Doran and I will be co-coordinating the 2024 sheep study. We've been already doing training for it, reviewing the questionnaires, and getting geared up for it. And national data collection for that will start in January, and it runs through usually July or August. Next slide, please. These are the states that are participating. It's a large number of states, depending on the sheep population. So this study is focusing on large and small scale sheep producers. So that's why there's such a large selection of states involved. Next slide, please. So the study objectives for the sheep study, like I said, are to describe management and biosecurity practices, identify producer concerns, describe antibiotic use on these farms, which is always a topic of concern, describe management practices that producers are using for internal parasites. Antiparasitic resistance is a big concern for sheep and goat producers across the U.S. And then describe changes in management, health, nutrition practices since the previous sheep studies have come on. And then this also gives USDA an opportunity to collect serology or blood samples for use in future research. Next slide, please. The tentative biologic samples, these are pretty concrete now that we're moving forward with the study. So we kind of use a carrot to entice producers to participate in these studies. Otherwise, it can just seem like a lot of their time wasted answering questions for government people. So we do offer them some biologic benefits. So for the sheep studies, stakeholders provide input on what would be valuable information for them to receive, and USDA does what they can to work with providing that back to producers. So we will do fecal samples, including fecal egg counts for parasites, and then some enteric pathogen testing. The blood samples that we collect on these farms, the producers won't get any information back about that, but we do use that information for future research at USDA. And then foot rot is a huge problem for sheep producers across the country. So doing some interdigital swabs for pathogens for foot rot testing will be valuable for them as well. Next slide, please. Rabies surveillance. Minnesota field staff are extremely busy with scrapie surveillance. Next slide, please. So the national goal for scrapie samples collected at slaughter facilities and on farm across the nation is 40,000 samples per year. That's sheep and goats combined. We're not going to reach our goal this year for a variety of reasons, but we're doing pretty well. Most of these samples are collected at slaughter. That's the RSSS circle on the bottom left, and then about 1,300 of these have been collected on farm, and that gets reported either by a veterinarian or a producer with animals exhibiting suspicious signs that could be consistent with scrapie. Next slide, please. So every year, USDA determines national sampling minimums for states. And we also have that 40,000 animal across the nation goal in mind as well. So Minnesota has met and exceeded our sampling minimums for fiscal year 2023 by a lot. Our goal for sheep sampling in 2023 was 252 samples, and we've collected 613. Our goal for goats for fiscal year 23 was 97, and we've collected 194. So we have met and exceeded our goals for this. Next slide, please. This is a very busy slide, but it's really important. So the biggest takeaway from this slide is that our Minnesota field team is just doing awesome at sampling, not only meeting the Minnesota goals, but also helping numerous other states meet and exceed their sampling goals. So Minnesota has collected samples that have helped other states like Iowa, South Dakota, Wisconsin, Oklahoma, and Arkansas meet and exceed their sampling goals. And otherwise, these states might not have met their sampling goals. So it's really important. It's an important program, helps us out nationally. And I did want to point out this is a state and federal team. So we're really doing a great job working together here on this program. Next slide. Here's our less fun update. You can go to the next slide. So hiring has seemed to be a constant battle over the past few years. We have several open positions across VS in Minnesota. So we have 3 positions in our Team South region, a field VMO or veterinary medical officer, and then 2 animal health technician positions are open in the South. We did get a new position created about a year ago called the Ready Response Corps VMO. So that's essentially during peacetime, they operate as a regular field veterinarian for our state. But during outbreak situations, they would be expected to deploy frequently and first. So we have a Ready Response Corps veterinarian hired. There's been a little bit of logistical difficulty getting her to Minnesota, but her tentative start date is in December. And then kind of a bummer for these other 3 positions is that this summer, veterinary services adjusted their hiring prioritization. So we don't necessarily have funding to fill all 3 of these positions, or they potentially might not be filled in Minnesota. So we don't have a lot of information about if and when these positions might be filled or funded. Next slide, please. And then some new welcomes to the VS Minnesota team. Joseph Brenny is our new program assistant. He started in May. And then Tina Cruiser, she's not new to VS Minnesota, but she is new to her position. She took over as the animal identification coordinator in July. She was previously an animal health technician. And then me, I was previously a field VMO, and now I'm your new epidemiologist for Minnesota. Next slide, please. And that's all I have. But Stephan was very proud of this sheep picture, so she wanted you to all see it.
Are there any questions?
I just wanted to make a quick comment. I wanted to recognize Dr. Steve Just, who is our designated scrapie epidemiologist. So he's been working with the scrapie program for way too long. 15 years. I'm looking at Joni, see if she remembers. long time. And he's just done a really great job coordinating our efforts and getting those samples and making us the leader in sample collection from that's great to those programs. So great job, Dr. Just.
Thank you. Any questions for Mackenzie? Okay, thank you for your update. Joni.
Morning, everybody. I'm Joni Scheftel, State Public Health Veterinarian at Minnesota Department of Health. And our update is mostly about the human health follow-up of the animal anthrax cases that occurred in Minnesota in July. And for the main part of the update, Kelly Shank, who's our CSTE 2-year fellow, is going to present a few slides, but she couldn't be here in person. So CSTE is the Council of State and Territorial Epidemiologists, which is analogous to the USDA or United States Animal Health Association. It's just the state level folks on the human side working on human disease control versus USDA. So anyway, I wanted to give the kind of the introduction to this because I'm getting so old, I know a lot of history. So in Minnesota, we get animal anthrax about every decade or so. And in the recent decades, it's been on the northwest edge of our borders. But decades and decades ago, it was in the southwest. So it doesn't have to be in the northwest of Minnesota. And you might be thinking, well, I remember the health department being part of this, animal anthrax follow-up in the past, and you'd be right, because ideas have changed just in the last decade or so. So normally the human side is really only worried about bioterrorism in anthrax, where the spores are manipulated in a lab so that they'll be more, they'll be aerosolized, and sometimes they're manipulated to the point where they're also antimicrobial resistant, making them like a bioterrorism agent. But and we haven't worried too much about naturally occurring anthrax that affects human stuff, because it doesn't aerosolize well, and there are very few human cases in the United States. They occur, fairly commonly, mainly cutaneous anthrax in other parts of the world, but there's a lot of making hides out of animals that have died of anthrax, stuff like that. So, Department of Health has not been involved in this, except in the most egregious of exposures, like in Minnesota, we had a family that ate an anthrax cow. That's a bad thing. But besides that, we haven't been involved. But in the last 10 to 15 years, what's happened is just a few, like one-off human cases of naturally occurring anthrax that occurred in one of these stories is a couple that flew to the Midwest from Florida. They're Florida residents, took a driving trip all through the West, ended up in Fargo, started driving back to return their car, and came down with anthrax in a Minnesota hospital. And that's how we got involved. And we couldn't figure out, CDC couldn't figure out, nobody could figure out how this man got anthrax. They went through the West. There was a couple pictures they had with like buffalo in front of bison in front of their car and stuff, but the spores could not be found in their stuff or their car or anything. And so that's one example. And this was naturally occurring anthrax. And luckily the man lived, thanks to some really astute healthcare providers. And also the fact that anthrax looks pretty special on the lung x-ray. But, and then there have been just one or two other cases where someone comes down with naturally occurring anthrax. And so we've had to readjust our approach. And so we inserted ourselves into this. Dr. Cornille and Dr. Cater got us involved right away. And it was really a partnership getting through all that. So I'm going to step back, let Kelly present a few slides, and then we can both answer questions at the end.
Can everybody hear me okay? Can everybody see the slides?
Yes.
Okay, perfect. So hi, everyone. My name is Kelly Shank, and I am, as Joni said, the Applied Epidemiology Fellow right now working with the Zoonotic Disease Unit. Thank you so much for having me, and I'm sorry I can't be there in person. So Joni and I just wanted to give you kind of a brief overview of some of the human elements of anthrax, and also just to give some insight on our protocol during these situations. So first, I know you all are familiar with animal anthrax, but I wanted to give a brief overview of anthrax in humans, as I mentioned before. So symptoms of anthrax in humans vary based on the exposure type. The severity and fatality rate of anthrax in humans are really dependent on the dose, exposure route, and when treatment begins. And the three main kinds of anthrax that people can get that we're really concerned about are cutaneous, gastrointestinal, and inhalation. And so there are some shared symptoms across all these types of manifestations of anthrax, but there are some symptoms that are very specific to the route of exposure, like the Eschar and cutaneous anthrax. And most human anthrax infections are actually cutaneous, and the most severe form of anthrax is inhalation. And in the case someone is exposed to anthrax, we will monitor them for symptoms and sometimes give them an antibiotic as post-exposure prophylaxis if needed. And so during some of the symptom monitoring that we do after people are exposed to anthrax, we basically give them information on what these symptoms are and also check in with them once a week just to make sure they're feeling okay. And so I just want to give that very brief overview as we go ahead and talk about what happened in July. So in July, we were contacted by Dr. Cornille and Dr. Cater about the animal anthrax outbreak. They pretty much contacted us immediately since they knew they were likely human exposures to some of these animal cases. At this point, we realized there wasn't a straightforward assessment to decide if someone exposed to naturally occurring anthrax needed to be monitored for symptoms of anthrax or if they would need post-exposure prophylaxis. So we went ahead and did some digging and collaborated with South Dakota Department of Health. And I ended up being able to find a publication by a veterinarian down at CDC named Dr. Antonio Ferrari. And we were able to use some of his publications to create an occupational exposure risk assessment that we incorporated into our interview that I'll explain in about a minute. Our goal was to really ask questions that would help us recommend if symptom monitoring and antibiotics were needed for each person, as well as just to gain some more insight on the situation as a whole. And so with the board's help, we were able to identify and interview 5 producers and a veterinarian who had exposure to ill animals or carcasses. And so during the interview, we first asked people about the story and seeing if they're having any symptoms now, just to kind of gain a better perspective on the situation. And then we jump right into an occupational exposure risk assessment. And so in this occupational exposure risk assessment, there's about 17 questions we ask, all of which are yes or no questions. These questions ask about contact with ill animals or carcasses, any animal byproducts like hides, wool, or bones, or any activities that would produce a dust or aerosol. And so, for example, if someone said, yes, I moved an animal carcass, we then would ask actually about PPE use. If that person hadn't used gloves while moving the carcass, for example, we would then assess the risk of exposure as moderate. And so that risk assessment really goes from low to high based on the kinds of exposure, duration of exposure, PPE use, and stuff like that. And so moderate risk exposures like touching an ill animal or carcass without gloves would require 14 days of symptom monitoring and 7 days of antibiotic post-exposure prophylaxis. And most exposures that people have are probably going to be in this moderate category. And when we did conduct these assessments, what we ended up finding was pretty interesting. So 2 people had low risk exposures. They had helped with vaccination of their herds and touched ill animals or carcasses, but they wore gloves, long sleeves and pants, and boots the entire time, which is sufficient PPE for the kinds of things they did. And we actually only ended up doing symptom monitoring for 14 days on one individual because the other individual in the low risk category actually wasn't interviewed until after their 14-day monitoring period was over, so they were all good and fine. We then actually were able to assess 4 individuals of having a moderate risk, and they underwent symptom monitoring for 14 days and took 7 days of doxycycline as PEP. And we just did that out of abundance of caution. And so these individuals either touched ill animals or carcasses without gloves or were not wearing long sleeves and pants. And so we were really happy to report there were no human illnesses. Everybody was very cooperative, very kind about the whole situation because we know it's a huge burden on them. And we are really appreciative to the board because your ability to facilitate those kinds of relationships was the reason that this was such an easy process for us. And so connecting with the producers and veterinarians in this situation was so critical, and we can't thank you enough for that. And so following this whole entire situation, we wanted to create a educational document to provide to producers after future exposures to animal anthrax. And so this was a joint effort between the Minnesota Department of Health and the Board of Animal Health. And as you can see, I'm not sure if you guys can see my pointer, but this symbol up here actually is the kind of joint label that we use on documents that are not just coming out of the Department of Health. I wanted to point that out because I know it looks a lot like the Minnesota Department of Health kind of symbol up in the left-hand corner, but this is actually the joint one, and there is contact information for the board as well as us on this actual information sheet. So our intention is to be able to mail or email this out to providers just so they have the actual symptoms on hand as well as some more information on anthrax in the future. And also we wanted to share that we're hoping to get our occupational exposure risk assessment published so that people in the future can continue to use it and modify it for future outbreaks of animal anthrax that have occupational exposures. And with this, there's a lot of people we want to thank. We are definitely so grateful for the board's help and all the awesome things they were able to do in order to make sure the situation got handled really quickly. We couldn't have also done it without the help of some of our collaborators in South Dakota, as well as the Bacterial Special Pathogens branch. And so we can't thank everybody enough for their help with this, as well as the help of the epidemiologists on our team. So I think that's about it for what I have, but thank you so much for having me, and I can take any questions. Me and Joni can take any questions.
Are there any questions?
Any update on COVID?
Update on COVID. I don't do COVID anymore. Who doesn't do COVID anymore? Although everybody seems to be getting it in Minnesota right now.
That's what I'm saying.
Joni, the state fair was quiet this year from your perspective?
The state fair was good. Yeah, I should answer for everybody because, for all the species, because my old vet partner, Holly Nathan, and I do the sheep and the goats.
Yeah.
And she's not on the board, of course, and you may not know this, but I did years ago too. I was on the board of animal health while I was still in practice. And the goat shows have been somewhat what I call clean for a long time now, but we're working on the sheep shows and they're coming along really good.
Sure.
Hey, our VBL update.
Good morning, everyone. Thank you for having me again. I don't have a presentation. I'll just go over my notes. But I want to touch on some things, some updates for the VDL. I believe the last time that we talked, it was in April, so a few things have happened since. So I'll start with finances and volume of testing at the VDL. So the last time we talked, we closed our fiscal year 23. We actually did pretty well in the last fiscal year. We had an increase in revenue of about 11%, an increase in tests of about 2%. And we ended the year in the black and actually with a surplus. So that was good. Now, it's not as good as it sounds in that the secrets for that good year were basically three things. One, we raised fees in 2022. Two, we were unfortunately understaffed in many different levels, obviously the director position, but also other levels that we've been talking about in these meetings. And three, we were actually really busy. It was a busy year in terms of testing. 2021 was a very slow year. Then 2022 samples came back to the lab and we were really busy. So that was kind of like the secret for that successful fiscal year 23, the combination of those three. For fiscal year 24, we put together a balanced budget. And we're hoping that, again, there's not going to be a surplus because we're hoping that we're going to be fully staffed and be able to actually have people take vacation and take breaks and so on, which is something that didn't happen very much in fiscal year 23. But anyway, a few things that are changing already in the few months that we have in the next fiscal year, in the current fiscal year. So there's a couple of things that we are trying to adjust based on the projections that we have for this fiscal year. There's already changes. We are seeing a reduction in the number of samples. And so, like I said, past fiscal year, there were a lot of samples coming to the lab. These first months, we're seeing fewer samples. Hard to tell in the summer. That's predictive of what's going to happen in the whole year. The summer is always very variable, but still, we're seeing a decrease in the number of samples. I'll talk a little bit more about staffing needs, but we're seeing a need to do a better job at retaining and recruiting. And we would like to try to increase salaries for some of the positions that we think are more in danger in our lab. And then some other good things are happening. Well, I'll finish with the bad things. As you know, the inflation has been pretty high for a while now, and so our cost of supplies have gone up quite a bit. And so we are considering, whether we need to increase fees at some point or not yet, or by how much. Other laboratories are increasing fees. We have not made that decision at this point, but we are seeing an increase in the cost of the supplies and the labor as well. So anyway, another thing that has changed, some additional money has been made available through the NALM. The NALM is one of the networks that we are part of as one of the laboratories that does collaborate with the USDA to do testing for some of for animal disease and regulatory diseases. We receive funding from a little bit of funding from the NALM every year, but now it's actually happening right now during the past month, this month and next month, we're working on receiving additional funding for the next 2 years from the NALM. And so that's a good part about things that are changing. And I'll tell you a little bit more how we're planning on using that type of funding. So that's the good news. And I'm trying to see how we can balance all that for this current fiscal year right now. So that's in terms of finances and volume of testing. Then I would like to move to some comments about personnel. First of all, I wanted to introduce to all of you our new pathologist. If you remember a year ago, we lost a food animal pathologist, Dr. Schaefbauer. We opened that position. It took us a while to recruit a food animal pathologist, but finally we have Dr. on board. And he came along today. I thought it would be a good opportunity for him to meet all of you. Albert is a veterinarian originally from the small country of Andorra in Europe. He did his veterinary studies in Spain, and he got certified in pathology, veterinary pathology in Spain as well. Then he came over here and he was doing his PhD. He's about to finish his PhD. And we actually used him in the past as a part-time pathologist. And now we have been able to hire him as a full-time food animal pathologist. And some of you might actually have interacted with him as well already, since he was the one who identified the first case of rabbit hemorrhagic disease here in Minnesota. He was in communication with some of you already when he was doing part-time work for us. So very happy to have Albert on board, and today you'll have a chance to interact with him. Next thing on personnel, the director position. Last time we talked to you, there wasn't a lot of activity in the director position, not a lot of good candidates. That has changed. We had good candidates. We had 2 interviews a couple of weeks ago. And now the committee and the dean are working on the follow-up of those interviews. And I'm hoping that we're gonna know something soon about where we're at with that. So good news on the director position search. And also about personnel, some of you know Dr. Sawatzke. He was the poultry pathologist at NPTL. He decided to go back to his country of origin, Jordan. And so now we don't have a poultry pathologist. We're down a poultry pathologist, and we don't have a poultry pathologist at NPTL right now. We have worked to open that position. That position is has been authorized. We are putting together the committee for that search. Everybody in the committee has accepted our invitation. When I say our, I'm working with the department head at the Veterinary Population Medicine Department at the university. Everybody has accepted, so we have a committee now, and we're in the process of getting together the first committee meeting so they can start working on the search for the new poultry pathologist to replace SAD. And finally, the last thing about personnel, again, we are seeing we're having people leaving the lab for other positions. We're seeing that we are not as competitive in terms of salary as we would like to be. Benefits of the university are good, but the salary is not so much at different levels. So at the manager level, at the technician level, different levels. So we have a turnover that it's higher than what we want. So we're trying to work on both recruiting and retention. And a couple of things we're doing a little bit different for recruiting. We just participated for the first time ever in a job fair as the Veterinary Diagnostic Laboratory last week, actually. And we are scheduled to participate in 2 more in this fiscal year. So we're hoping to, people don't really know about that very much. So we're hoping that, people will consider us as an option. And we're also starting to advertise our positions a little different. We're realizing that we need to be fighting for those candidates out there. Like in many other fields, it's hard to recruit people. So we're trying to do more effort into that. So that's for personnel. I'm gonna move now to equipment, news on equipment. Last fiscal year, at the end of June, we finished spending the monies that got allocated to us for by the legislature. We received $1.25 million in the legislature specifically for equipment. So we've been buying a lot of equipment during 1 year. We needed to get that money spent, otherwise it would have been gone. And we were able to spend it in that 1 year. It sounds easy, right? You just go and buy things. But as you know, well, first of all, we started a little late with the change in director. And second, a lot of equipment has been back ordered. And some things like we had to wait for months until we could receive them. But anyway, we've been working with the Department of Ag, has been administering these monies. And we were able to order more than 100 pieces of equipment, from things as simple as little things that cost $15 to machines that cost over $100K. Things from a table from the necropsy floor to or a saw from the necropsy floor to a PCR machine, an extraction machine, a crane to move animals around. Every section of the BDL has had their equipment updated. So that was really good. There's another pot of money, smaller, $250K, available for this fiscal year, and we're planning on using that again for equipment only. We're planning on using that to get a better system for a generator for NPTL, so that when the power goes off, the whole lab can continue working with no problem. So that's a plan for that. And then the last thing on equipment, I think I mentioned it the last time, probably the last several times that I talked to you, but the university has agreed to replace the digester that we have at the BDL. It's not our equipment, it's the university's equipment, we manage it. The digester is the a big piece of equipment that we use to get rid of all the infectious material or most of the infectious material that we generate at the laboratory. So it's very important for us. But we also receive other materials from the university. That's why they own it. A very expensive piece of equipment, very old, 20 years old, in middle replacement. But really, we as a BDL only could not have replaced it on our own, and the university finally allocated the monies. They're gonna fund it. It's not gonna be the BDL. It's not gonna be the college. And they put out the project for bids. There were several bids. They selected a contractor, and everything is moving along. It's a big project, so we won't have a new functioning digester until December 2024. But things are moving along as expected. And we are now having weekly meetings with the contractor, with the university facilities, with us. And believe me, there's things to talk about every week for this project that is going to take more than 1 year long. So we're very excited about it because we really think it's a critical part of a piece of equipment, and it's being used by the board in several occasions. So that's in terms of equipment. Let me quickly talk about new test processes that we're incorporating. So I would like to highlight the work that we're doing on automation for PCR. The PCR lab has several steps, and we have identified, and this is a couple of years back, we identified several areas where we could automate processes to be more efficient. And we've been able to little by little introduce these improvements. So we have now robots that were purchased a couple of years ago. It's not as easy to implement as it looks like. Now the robots are working full time. I think the last time I talked to you, we were starting to use them. Now they are being used full time for one of the steps of the PCR for all regular PCR work. This will also be used for in case we have a foreign animal disease outbreak. And we're working on the results reporting part. And there we have a few tests that we're already doing the automation work. We're already using it for routine, and we are increasing the number of tests that we do that. And then we have a couple of new tests that we have incorporated recently. A test for Cysticercosis coccidia in pigs, PCR test. PCR test for Actinobacillus suis, and those are new tests that we didn't have that we now have. And then we have replaced 2 different ELISA tests that we have, and we have found better versions of it. So we keep looking for things to improve at the lab. But those have been, in the past few months. Finally, I wanted to talk a little bit about, just a couple things about things that we're seeing, trends that we're seeing, or things that we're seeing in the last months. Very quickly, one of them, and I think we're going to talk about that later today, is like every summer, like every August, September, we're seeing an increase in cases of vesicular disease in slaughterhouses, and those get investigated as foreign animal diseases. I believe there's one today at the lab. We usually get samples and report results the same day, if not the day after. And those get tested for foot and mouth disease, and they have been all negative for foot and mouth disease. They get tested for Seneca virus, and most of them have been positive for Seneca virus. So again, it's the same trend as every year. We don't know exactly why. August, September, these cases start popping up, vesicles in pigs, and we just have to do the work to make sure that it's not foot and mouth, and it turns out that it is Seneca virus. So we're in the middle of it. A lot of you are involved in these efforts and copied in all the emails when you report, you send the samples to us and then you report when it's negative, good, you can remove the quarantine and so on. And the other one would be, we have seen this year a few cases of West Nile virus. I believe you have reported West Nile virus in horses. At the lab, we had one horse, but this horse was from Wisconsin. It was reported both to the board animal health here and to Wisconsin. And we've had a couple of cases of West Nile virus in wildlife. There was a squirrel, there was a crow, and one more I can't remember. So in terms of, trends or things that we're seeing at the lab, those are the two that could come up, right now, other than the usual suspects. And now to close, okay, all right. Just wanted to mention a few areas of improvement or what's in my to-do list. There are things that we need to improve on, and I wanted you to know what's in my list. So one of them would be CWD testing. We're still not doing the testing in-house. We want to bring it back in-house, and we're working on that. We know that we need to change that. Another one is bovine diagnostics. So I've been waiting to hire another pathologist to be able to actually better serve the cattle industries, and we need to get in contact with them and see what we need to do to cover their needs. Another one is next generation sequencing. There are some improvements that we want to do internally. Obviously, the poultry pathologist position is a priority. I already mentioned that is ongoing. Efforts for recruiting and retention. And then a couple of other things would be quality and IT. We need to reinforce the lab in terms of quality assurance and IT. Every project that we want to develop now, we want to do this automation. We want to bring in these tests. We want to work with this company. Everything has an IT component, requires IT effort to link what we do with whatever it is that we want to incorporate. And so I mentioned those two, IT and quality assurance, because I mentioned before the additional funding that we're getting from the NOW for a couple of years. And we're actually going to be using some of that funding to bring in more people that can help us with IT and quality assurance and to, bring us to a higher level in those aspects. And that's all I got. We have time for questions.
We're ahead of schedule, so.
Good. We don't want to go to prison or anything.
Other question?
I'll make this in the form of a question. I don't know if I can. I'll tell you what I want. I want a PCR test for tularemia. We're seeing it more and more cats, and it affects us because people get exposed, and I happen to know, because we get the results here, that a whole bunch of tularemia PCRs are going to Colorado from small animal practitioners. And that would be so helpful. It's send that to the media.
That's great to know. I didn't know. We use you for PCR to confirm our tularemia cases. So when we isolate it, we send it to the Department of Health. But it's interesting to know that cases are going out of state for confirmation.
I don't think we're running PCR. I think we're.
Well, then it must be just confirmation by Hoefs or.
Yeah.
Yeah. Okay. So just last week, we had an internal meeting about trying to put all the different veterinarians who work at the lab together to express their opinions and their the Christmas list on what they want for PCRs, and believe me, it's long. Everybody has their own opinions and their own priorities. And it's interesting because that's one that didn't come up because we feel like we're covered, but obviously we're not seeing what happens outside and what doesn't get to us. So I'll add it to the list. We're now in the process of prioritizing.
It's silly, question to follow up on that, Joni. Would that have to be running in BSL-3 because it's a bioterrorist or for the PCR, right? Because the PCR could be running.
Yeah, no, clinical samples are exempt from some of those BSL-3 rules.
Okay.
Can you explain what tularemia is?
Yeah.
Good question. I'm a thirsty person.
It's called rabbit fever because it's a bacteria Francisella tularensis that is really fatal in rabbits. And so we used to see tons of it in people when people hunted rabbits and cleaned and during the butchering process might cut themselves. But, and we didn't think we had it in Minnesota anymore. When I was in vet school, we didn't have tularemia, and then Arno Wunschman came to the VDL. He invented tularemia in Minnesota. And now we see, maybe half a dozen or more cats a year that are diagnosed at the PDL through culture because the cats eat the rabbits. That's how they get it. And then the people get it from getting scratched or bitten by the cat. There are other ways to get it too. It's a complicated disease. It's also found in water animals like muskrats and beaver and things. So there's two different types. I can't go into all of it, but it's complicated disease, but we need a PCR to diagnose it more easily.
Okay. Thank you. Any, go ahead.
Sorry, that's okay. So Dr. Rovira mentioned for animal disease investigation and our current uptake based on the slaughter plans, and I just wanted to recognize efforts for Dr. Rovira, Dr. Rosal, and other technicians. They are just so responsive, so helpful, do a great job coordinating. They're always ready for us and really helped us run smoothly, and sincerely appreciate that. Thank you.
You mentioned about the digester that you're in this replacement. Did I hear you right? You won't have any form of digester in place between now and December 24th?
Oh,
or is that?
No, I'm sorry, I didn't explain that very well. The current one is working.
Okay.
But we know that, it's been failing here and there. When it failed, we have a system in place on, how to cover for that in the meantime. But it just needs to be basically, it's just becoming very old. There is going to be though a period of time because it's a big machine. We're gonna have to actually do some remodel on the area of the lab where this is. It's gonna be a big project. There's gonna be a period of 2 to 3 months. But this is going to be next year, in the fall of next year, where we won't have a working digester. Now we do. So, to answer your question, yes, we're gonna have a period of time. It's not gonna be that big. It's gonna be 2 to 3 months. And we're looking at what solutions they are offering us. There are different ideas. And we don't have that figured out quite yet. But we have about a year to figure out to put that in place. So there's digesters that on wheels, so to speak, that you can move to places to do that type of work. There are companies that take on these waste that then it can be very expensive, and they might take some, but not all, because at the university there is some research, depending on what they are doing, that some of these companies might not take on. So it's not us, but there's a part of the university waste management that is looking at, okay, what's the best alternative for these 3 months that there's going to be no digester.
From a corn animal disease risk standpoint, you have a mitigation step in place, given the status of the lab and the FDA.
Right, and so there's a couple of things that we can do. For smaller animals, we can autoclave them. That's what we done, for example, with HiPath AI. We autoclave them, and then in addition to that, we digest them. Other than that, for example, with HiPath AI, we didn't receive a whole lot of carcasses because we tried to keep everything contained at the farm, composted there, and so on. If we had ASF, there could be a situation where we already have issues at the lab by the time that it gets detected. So there might be some of that, but my impression is it would be similar, where we try not to send, whole carcasses to the lab and just samples, and work on the board on how we use it, we work on the population after that.
Wow, thank you.
Any other questions for Alfred? Great, thank you for your update. Looks like Laura Molgaard is here with us already.
Good morning. Would you like me to share my screen, or did you want to project the slides that I sent in advance?
If you're okay with sharing your screen, that works, but we'll go with that.
You bet. Let me see if I can do that properly. Choose what you want to share. How do I do that? Okay, here we go. A lot of experience with Zoom and less with Teams. It looks like you're seeing the right thing.
Yeah.
Okay, great. So thanks for this opportunity to share what's going on around campus at the university. So you may recall that we've had a number of leadership searches going on and a number of people filling interim roles. And I'm really pleased to say that we've had a lot of progress here with the searches coming to conclusion with new folks, some internal, some external, who've agreed to take these roles. So Kent Reed in the Veterinary and Biomedical Sciences Department, Maxim Chirin, our new Associate Dean of Faculty Affairs, Amy Snyder, Associate Dean of Clinical Affairs, which is a new position taking the place of the old hospital director position. Sandra Godden, our Associate Dean for Graduate Programs, and Monse Tormorel, taking on the permanent department chair for the Veterinary Population Medicine Department. And then the search continues for the Veterinary Diagnostic Laboratory Director, but I'm making great progress there. So I hope to have an update for you by our next meeting. So that makes a huge difference for me and for the college to have our leadership team almost complete after 4 years of a lot of transitions, primarily due to the hiring freeze that was in place in the first couple of years of the pandemic. So these leaders are really important as we begin to implement our new strategic plan. I think I may have shared this with you at our last meeting, but these are our 3 pillars of our strategic plan: engagement of people, infrastructure, and partnerships and constituents. And we certainly count our partnership with the Board of Animal Health as one of our most important partnerships. And you can see that these are 3-year goals, but under those goals, not pictured here, are a series of strategies that are 12 to 18-month strategies. And this strategic plan just began in July, but we've already hit the ground running with implementation teams that are working on those 12 to 18-month strategies. It's been very busy this fall already. We hosted a welcome back event for our students, and just last week I helped welcome over 800 attendees at our annual Layman Swine Conference in St. Paul, as well as the director of USDA APHIS, Rosemary Sifford. So lots of activities, and those are of course just a couple of them that have been going on around campus and around the Twin Cities. This summer's affirmative action ruling by the U.S. Supreme Court did not require any changes for our admissions process. So we were very well prepared for that. Speaking of admissions, our deadline for the class of 2028 just closed, and we received over 1,500 applicants for St. Paul, and in South Dakota State, we received almost 250. So that's just over 1,800 applicants for the combined 125 seats in the DVM class that starts next fall. Also this fall, we welcomed the first 20 students in the 2+2 program to St. Paul for their final 2 years of training as transfer students, and I had the pleasure of interacting with a number of them. Some of them joined us at the SDSU Drake football game that was held at the Twin Stadium, of all places. That was fun to join them for that. The Jackrabbits definitely prevailed in that football game. It's great to watch a team really dominate like that. And they're already making valuable addition to our class of 2025. When the students came back to campus this fall, they already are spending some time in our new Veterinary Skills Laboratory, or VSL. This facility provides greater access for students to gain proficiency and confidence in their clinical skills. So it's a modernized space on the second floor of our facility. And this is just phase 1 of our vision for what we're calling our Transformational Learning Corridor, or TLC, that remodels several student spaces in areas next to our old large animal hospital. Happy to show people around anytime you might be on campus. Another update from campus. June 30th was the end of our fiscal year, and so we tallied up our research funding and productivity over the last 3 years. And we can see that our faculty have been successful in nearly 3 out of 5 times of grant submission, which is an amazing success rate. Their creativity and expertise on important research questions has yielded nearly $73 million in funding over the past 3 years. And on this slide, you can see the top 10 funders of our research. This summer, we were talking about Star Tribune editorials with the Star Tribune about the shortage of veterinarians. And today I'm going to spend a little bit of time talking about the shortage that is affecting our college, and that certainly affects the future of the profession. Now, this is data from Dr. Jim Lloyd. He is former dean of the University of Florida. Now he's a veterinarian and an economist, and he does some work for the AAVMC, Association of American Veterinary Medical Colleges. And he's looking at not just the shortage of veterinarians in general, but the shortage of veterinary faculty. So we can see the dramatic increase in unfilled veterinary faculty positions that has increased from 2012 to 2022, and the change in the veterinary student to faculty ratio. We can see the veterinary school enrollment has changed over that period of time, and we can see that the number of veterinary schools that are being planned in the US has dramatically increased. So we definitely need new faculty, which requires, of course, new funding that is not likely to be coming anytime soon from the state, because states have seen declining all states have seen declining support from not just veterinary schools, but higher education from state legislatures. So it's a challenge that we do not have an easy solution for, but I just wanted you to be aware that it is something that threatens the future of animal health, really, not just the profession. On the legislative front, we do have some priority items. Licensure of veterinary technicians. We want to make some honestly very minor changes to the Practice Act that will allow the veterinary school to the university to hire faculty that are trained at highly regarded international veterinary schools that currently our Practice Act limits. And the university is looking for funding for HEPRA, which is just an acronym that's really about repair of aging facilities. So that is the first two are veterinary school priorities, and the third is the university priority that benefits all of the university. The Governor's Task Force on Academic Healthcare has been in the news, and I'm proud to say that we are closely involved in the information gathering process, and we will have our time in front of the Board of Regents coming up here in a few weeks. So these last two slides show some of the information that we've been sharing with the Board of Regents, making the case that the College of Veterinary Medicine adds value to the health of Minnesotans through animal health, human health, and the environment we share. And with that, I will ask if there are any questions.
I just have a quick question. I don't know if you have the data, but so the new class that just started this year started in the fall, and we haven't had a meeting since then. Do you have some information, how many students and how many will be from South Dakota, and what that class makeup kind of looks like?
Of the class that just started this fall, right, that are freshmen?
Correct.
And how many at South Dakota are from South Dakota?
Great. That will be joining Don't they come in 2 years later
Yes.
to join that class?
Yes, so I do have that and I can pull it up here really quickly. It might not be the first year class. It might be the class that is, that has just applied, but Dr. Juarez is the program director there. And she did just share some exciting new updates. And it is for the 2023-24 cycle, where their total applicant numbers are up and the applicants from South Dakota are up in this cycle. The applicants from South Dakota are up and the applicants from Minnesota are up. I don't know yet, of course, which of those will be admitted. So I would have to get back to you for the freshman class. I don't have that top of mind.
Just curious, they always used to come out with how many men and how many women and how many had bachelor's degrees and how many didn't.
Yep. No, we definitely have all that information, but my former encyclopedic memory has been so damaged over the past many years that I no longer possess that. But I have people that have all that data that I can certainly include in my next report.
Just a curiosity for me.
And Laura, I've got a question for you, and it's kind of a data question, so I don't know that you can truly answer it, but as you look at your vet classes, how many students come in that are interested in large animal or being farm vets?
Yeah.
And how many of those actually stick with that?
Yeah. Yes. So there are two answers to that question. And I will also include the specifics in my next presentation too. So,
okay, thank you.
But I can tell you the general answer to that, Erica. The Vet Fast program, which is our early decision food animal specific track, we have had like a 98% retention. 98-ish, but a 90, I mean, like 2 out of the total number of Vet Fast students when we last collected that information had not persisted in food animal over 10 or 14 years. It's dramatic how effective that program has been. And that's just one way that students come in for food animal. So there's the early decision program where we identify students after year 1 or 2 of undergraduate, give them provisional admission, and if they and then they we have a seat ready for them when they're ready for vet school 2 or 3 years later. Of those students that come in through that special pathway, they almost all go on to food animal practice, food animal or food animal mixed. But that's just one way that food animal students join the program. A lot of them also come in through the regular admissions process. And then they, the regular admissions process, we aren't admitting them as food animal or other. They're just coming in as students. But then we do surveys throughout their program indicating whether or not what their interest is. And then in 3rd year, we identify what they're actually going to track as. And so that's the information I want to get you for my next presentation at our next meeting. So I can tell you how many are actually food animal or food animal mixed. But I can tell you that we are leaps and bounds more successful in training food animal veterinarians than the vast majority of other veterinary schools. And that is partly because of programs like Vet Fast, and it's partly because we have maintained such a strong food animal faculty. And this food animal faculty is tremendously committed to mentoring these students and to providing these amazing courses and kind of track experiences so that students really can track pretty deeply in food animal or food animal mixed compared to again, I can't claim that we are the best, but we are definitely in the very top tier.
Okay, thank you.
You're welcome.
Are there any other questions? Don't see any other questions. Do you have anything else for us, Laura?
There are 1,000 other things we could talk about, but I know you have other business, so thanks so much.
Thank you.
Yep. All right, so we will give measuring our poultry program update. There we go. All right, so we, for the poultry program, we actually work out at the Minnesota Poultry Testing Lab in Gilmer. And all of the board poultry program activities are managed out of the MPTL. So the MPTL is a joint venture between the University of Minnesota, the VDL, and the Board of Animal Health. All the lab activities are conducted by university employees, and then any regulatory and NPIP program oversight is provided by board employees. These are our lovely poultry program staff, except for Dr. Voss, who didn't have a picture ready when I was doing this. So I'm Crystal Lautenslager. We also have Allison Pollock, Laura DeRock, and then we include Brian Sieber. He is actually one of our board field staff, but he is kind of our go-to if we have anybody with poultry that we kind of need. And he does a lot of our poultry work for us for many years now. And then, of course, Dr. Voss is our guide through all of this. So just talking a little bit about NPIP. This is one of our kind of main programs. It was established in the early 1930s to combat salmonella, full-arm typhoid disease. And so this is a national USDA plan recognized with standards. The Cooperative Disease Control Program for hatchery, disseminated diseases, salmonella and mycoplasma, and other diseases such as avian influenza. This helps promote interstate and international commerce. The programs are implemented by the official state agency in Minnesota. The board is the official state agency for it, NPIP, and this is voluntary participation by industry. So to just go into a few of our NPIP programs. So we have quite a few different programs. I myself, along with Dr. Voss, who oversees all the NPIP programs for us, work with commercial breeding facilities. So these are turkey and chicken sites. And there are 68 commercial breeding facilities that we work with in Minnesota. 8 commercial hatcheries. Again, these are chicken and turkey. 28 commercial table egg layer facilities. So these are float sites and then traditional egg layers. 6 slaughter plants. So this is actually a program that Allison Pollock works with. And so we have 6 slaughter plants, but I wanted to make sure we listed the source flocks. So these source flocks are the flocks that feed in to the slaughter plants. We have roughly 214 chicken sites and 451 turkey sites, and that's always a changing number for us. And then another program that Allison works with is our upland game bird facilities. We have 16 of these. Again, these are different types of NPIP programs. One rat type facility, for anybody wondering what a rat type is, it is emu, ostrich, cassowary, or rheas. The site in Minnesota actually has emus. And then we have 76 Wegby facilities. So Wegby
is waterfowl, exhibition, game bird, and backyard. So these are all of our backyard, folks who hatch, or they have breeding flocks that they sell out of. And we have 214 poultry dealers, and poultry dealers are gonna be, sent to sell chicks throughout the year. Traditionally, these are your runners, tractor supplies. Some have baby chicks on hand, and some will order birds in for producers. And so with all of these NPIP programs, and Laura Tabak works with our poultry dealers, with all of our NPIP program, they are permitted annually, and field staff complete an annual inspection, and we are also checking testing compliance for these sites. To go into our other programs, some of the other programs that we work with, we have a program that is authorized poultry testing agents. So in total, we have 932. This is broken up. So again, we have our commercial, and then we have our backyard, so our white bee. Laura in our office works with our commercial testing agents, and we have our white bee testing agents. We hold courses throughout the year. We hold a couple for our commercial sites to train new testing agents. Otherwise, they are reauthorized every 4 years. And then again, with our white bee one, we host at least one course per year for new participants, and we'll host a second if it's needed. And again, we are reauthorized. So reauthorization means they're going to be meeting with one of our USDA board field staff, and they will go over all the training, anything that they're going to need for those folks to be reauthorized for the next 4 years. We also have biosecurity plan audits. So these are biennial audits. And this is something that all of us in the office work with, but then we also have field staff who are trained to be our auditors. And these are paper audits that are needed for producers to be eligible for indemnity from the USDA for H5, H7 low path, and high path avian influenza events. And so just as a total, again, these are biennial, and so we do, in the last 2 years, we've done 94 of these. And just to kind of explain this, because we saw a lot of numbers, if it's a bigger company and they all work under the same plan, that's considered one. So some of our big producers will cover many sites under the same plan. And then I will move on to our rapid whole blood test. So this is a florin typhoid test that can be done in the field. And this is done by our white bee testing agents. And so what happens is they will do this test, pen site in the field. They send in that test chart into our office, and then we process these. So the rapid blood test needs to be done for people going to sales, exhibitions, and our annual testing. And so last year we processed 478 of them. And I looked it up yesterday, it's roughly about, I think it was like right under 13,000 birds that they would have tested. Okay, and then we also do a lot of our poultry imports. And so this is a great thing just because it's a lot of paperwork coming in for us. And so when we say movement documents process, these are VS9-3 forms. This is something that they use through the NPIP program. And most of them are actually electronic, thankfully, but we do still get paper forms that come into us that we have to process and send out. And we also have VS9-3Is, which is something that some of the larger dealers will actually send out that again, we're processing. And we have CDIs that will be coming in from other states. And so again, these are all documents that will be coming in that we process and we track for those birds coming in. And then another program that I work with is live bird markets. In Minnesota, we have 3 live bird markets. They are permitted annually. We have an annual inspection that again field staff do, and we actually have a handful of field staff that go out and test monthly at these sites. So they're testing again for avian influenza. So just to bring up the board rules, these are board rules relating to poultry. And so these are the rules that we follow for our day-to-day activities, and this is what guides our decisions within our day. And so we do create for our NPIP programs, just kind of a picture on here is our participation requirements. So each program that we send out has a participation requirements document that those folks are signing off on when they sign their application every year. And those requirements follow back to our rules within NPIP and then our board rules themselves. And then these are the board rules that relate to poultry diseases. Again, we have testing and sampling, and that is where our testing agent program came into effect and why we have our testing agent program. And then avian influenza is where we bring in live bird markets, because that is not part of NPIP. With that, I will pass it off to Dr. Voss.
Anybody have any questions for Kristen? Did you do a wonderful job? I have an absolutely wonderful team out at the NPTL, and so I want to give each one of them something on the more shout out, and Brian for everything that they do. They certainly keep me afloat for every day. So Kristen provided a nice overview of just poultry programs in general. I wanted to touch base on just a few disease issues that we've had and to get some of our new board members up to speed on what we've all been dealing with in the last year or so. So after 531 days, our high path event is officially over, and I'm very excited to be able to announce that. So if you guys remember back a year and a half ago, March 25th, 2022 was when our event in Minnesota started. And on that day, we have identified both a commercial block in Meeker County and then a smaller backyard block in Monroe County. And that kicked off all of the fun and excitement that we dealt with. On February 17th of 2023, we officially kind of completed our requirements and surveillance and actions that were needed to kind of self-declare ourselves free from high path and poultry. And I just want to specifically say that when we say poultry, that's what we're referring to the World Organization for Animal Health definition. So it doesn't necessarily factor in all of our kind of smaller non-poultry, which is just non-commercial flocks that were impacted because, as you see on the next slide, we did have a few more detections after that. And then on September 7th was when our last quarantine was released, and that was from our last detection in Nobles County, which happened after our spring board meeting. And that happened after a 120-day fallow period, which was required to kind of do that virus elimination. And thanks to Carissa, who did a lot of our sit rep, our situational reporting for our event, she was able to submit that final report to USDA September 12th, and we all celebrated. So where we ended up total, we had 112 cases from the start of the event to the end. And that was on 109 premises. So if you do the math on that, we had a couple of premises that got hit twice. 72 commercial meat type turkey facilities, 7 commercial breeders, 1 table egg layer, and 1 broiler, and then 31 backyard flocks. So over 39 counties, 4.2 million birds. And just for kind of a point of reference, in 2015, when we had our last high path event, that was fewer counties. We had 110 cases total. All of those were commercial except for 1 backyard. So that was close to 9 million birds that were impacted in 2015. And the big difference there is just the number of backyard flocks that were impacted this time. Questions on our high path event? I'm hoping this is the last update that we have to do, but we'll see. I also just wanted to bring to your attention another disease event that we had. We did detect a Mycoplasma synoviae case in broiler breeder birds, and that was detected on some routine NPIP serology testing. So as Krista mentioned, our NPIP participants are submitting blood samples to the lab every 4 to 6 weeks for monitoring, and Mycoplasma synoviae is one of those diseases that we do surveillance on. And so Stacey Pollock from the lab walked down my office with her head hanging low saying, we might have a problem with, some of the serology testing looks not quite right. And so we requested PCR samples on that flock, and those came in the following day, and they were all positive. So we did place that flock under quarantine. The testing that's done at the breeder flock certifies the hatchery for their NPID status, and so we did have to take away their U.S. Mycoplasma sinoviate clean status on that hatchery. As Krista also mentioned, we have board rules specifically for mycoplasma. And so this is the language that comes out of our board rules. And it just says that if we identify it, that flock needs to be quarantined and either disposed of or participate in an approved salvage program. And because this was such a young breeder flock, the company did not feel like they could dispose of the flock, and they would be very, very short on eggs and chicks. And so we worked through and developed a salvage plan to be able to maintain that flock in a safe way and limit spread, either laterally or through the hatchery. And so what's included in that salvage plan just includes how they're going to manage the flock itself, and they are treating that flock with antibiotics, even though that won't make the mycoplasma go away. It reduces the shed and reduces the likelihood that it will be passed into the eggs. And then they've got a protocol in place at the hatchery to segregate those eggs and make sure that the chicks that are being processed are separate from the other chicks being processed at that hatchery. And then they are swabbing some of those chicks before they do their antibiotic treatment, just to make sure that it is keeping the levels in check and we're not detecting it that way. And so far, so good on that. Shown on the mycoplasma situation.
Is there follow-up? Yeah, like after the life of that, why? After they're done in production. Well, I should back up. How long do you follow that salvage plan? And use it for the rest of the life cycle of that flock? And then once they're done, then what does it look like? If that makes sense.
Yeah, so this isn't something we've had to deal with in Minnesota, and it'll be a very, very long time.
Yeah.
I have been in communication with the NPIP national office on this, and there is kind of some protocols for, regaining that MS clean status at the hatchery. And so the big thing, first of all, is just get rid of the flock, and then all of those eggs have to be processed through the hatchery. And I'll still have to work out to see if there's any additional cleaning disinfection protocols that will need to happen at that time. So by my math, this flock would probably be in production close to or through the end of the year.
Sure.
This was kind of a bummer to detect, but it also highlights our surveillance strategies that are in place are effective, and they did what they're supposed to do. So we're continuing to monitor the situation. And the last thing that I wanted to bring up to you, Krista mentioned what a VIP is and how it was started based off of, the Florida typhoid program. And that is something that we continue to do a lot of testing for Florida typhoid disease, especially in our smaller flocks, because that is most likely where it's going to be detected. It is a disease that could be considered eradicated in the United States, but there are occasional detections, and so we just need to be persistent with our testing for it. Unfortunately, the antigen that we use out in the field to test for that is on back order, and has been since this summer sometime. And there's only one company in the entire United States, of course, that makes it, and that's used to be known as Charles River Laboratory, and now it's ABS Bio. And so we were originally told the back order would only be through mid-September, and now we're told that it's going to be through November. Unfortunately, we are nearly out of antigen ourselves. And so we are working with the NPIP office on a contingency plan. And one of our recommendations is we're trying to delay any testing of our breeder flocks, our annual testing, which unfortunately a lot of it happens in the fall. Just until that antigen is available. And then if we need to do that testing, because I don't really want to relax our board rules because of this, blood needs to be collected and sent to the laboratory, which is an added expense and less testing agents that can do that. So this is just a situation that we're monitoring. I wanted you to be aware of it. At this point, it should not affect any of our commercial blocks in our industry, but doing caloric testing does maintain our caloric typhoid clean state status. So it's not something that we want to kind of let go too long. We just want to keep a close tabs on the situation. And that's all I had. Any other questions for me on poultry programs?
Any questions for Shauna? Or Krista? Good job. Yeah, thank you.
I did have one question, Shauna. Could you just, what's the migration pattern looking like as far as potential for high path to return in the fall? I was on that meeting yesterday and I kind of missed the map and how the migration was going. Where are we at with regards to previous years? Are we kind of getting to the tail end? Are we right in the middle? What's your crystal ball saying about?
Yeah, I was gonna say, I'm probably not the person to be asking. You know, we know spring migration or fall migration are high risk periods for transmission of influenza, just because wild waterfowl are natural carriers. They're more likely to be moving that virus around. There's different tools out there like Birdcast. If any of you guys have not checked that out before, it's kind of a neat tool that just kind of tracks bird migration in general. It picks up every kind of birds though too, so it's not just looking at wild waterfowl. And so what I would tell the industry is from now until probably Thanksgiving, we need to just be extra vigilant and be on the lookout, making sure that our biosecurity is in place and we're taking any extra precautions that we need to. We're not seeing high path detections really anywhere across the United States, with the exception of some live bird markets out on the East Coast. But I don't think that means that it's gone.
So you said the commercial side was done with it. What about the backyard? When was the last report on that? Do you know by chance?
I want to say it was our Nobles County case of May.
Okay.
Any other questions? Great, thank you.
We are way ahead of schedule. Basically, this has never happened before.
Like is lunch available?
It was supposed to be set up by 5, so we just have a few minutes to. Yeah.
I want to do that. Okay. So lunch is in the other room? Or is it coming
I
here?
think it's coming in here.
Okay. Okay. Well, let's take a break then and get ready for lunch and can we reconvene on our actual time schedule?
I think that would be fine.
Okay.
Because we have that tour at 2:15 that you're gonna have a gap at the end.
So we will take a break and eat lunch and then start back up at 12:20. Ready for Mackenzie Reberg? Is she still on?
Yep.
Alrighty, I'm attempting to share my screen and hopefully you can all hear me okay. Alrighty, let's get started. Hope you all enjoyed your lunch. Can everybody hear me fine?
Yes.
Yes.
All right. Thanks again for letting me talk today about some swine vesicular disease updates from the USDA side. I'm pretty new in my role here as the epidemiology officer for Minnesota, but I have been a field veterinarian for USDA for a few years. So there's a lot of new faces at the board and around. So when we say vesicular lesions or vesicular disease, maybe not everybody knows exactly what that means. So vesicles are these blistery type fluid filled lesions that we see pretty commonly in a few different types of viral diseases, including several foreign animal diseases that we do not want to have here in the US. Usually they develop pretty quickly and then they rupture, leaving the erosive or ulcerative surface that you can see here that's pretty red. And these lesions are typically seen on the snout, in the mouth, kind of all around the oral cavity, and then they can also be seen on the coronary bands of the feet. Occasionally, we'll see some hoof wall sloughing with these cases, but typically we just see these kind of ulcerative lesions around the feet. So why do we care about vesicles? Any animal, and particularly swine, having vesicular lesions are considered suspects for foot and mouth disease, or just generally a foreign animal disease. So like I said, vesicles can form around the oral cavity, on the snout, and on the feet. A vesicle is a vesicle is a vesicle. They all look the same. You can't look at one and say, yep, that's Seneca, or nope, that's foot and mouth disease. Seneca virus is a domestic virus that we have throughout the United States. It affects pigs only, and we see it pretty commonly in late summer, semi-related to heat and humidity. So foot and mouth disease, hopefully you've all heard of and are familiar with, is a really bad disease that we don't want here in the United States. And it affects more than just pigs. Cattle, sheep, goats, and other exotic cloven-hoofed animals can all be affected with foot and mouth disease. Clinical signs in both of these diseases can be very mild, like you might only have one vesicle present in an animal that's infected. So a foot and mouth disease is a foreign animal disease that is super, super contagious, very infectious, spreads quickly, and would cause significant economic losses if we had it in the United States here. So every time we receive a report of pigs with vesicles, an FADI, or foreign animal disease investigation, is initiated. And this triggers a chain of events. So typically the people that report these disease concerns to us are private veterinarians, veterinarians at slaughter facilities, occasionally producers or other people at slaughter facilities. Once we receive that report, an FADD, or foreign animal disease diagnostician, is assigned, and we have 9 field FADDs in Minnesota currently. So we try to assign the closest one, but sometimes scheduling and other things going on, we have to make a few calls. But an FADD is assigned, goes out to the site where the animals are located, performs an exam. This is where their training is really important. These FADDs are specifically trained in recognizing foreign animal diseases. So their clinical take on the animals that they're looking at really helps us determine the priority and the concern level when they're out there on the farm looking at these animals. If necessary or clinical signs warrant, samples are collected, and then a quarantine can be placed at that time. So once the samples are collected, they're usually hand couriered or driven to the local NALM lab, which is a network of national labs that have proven clinical competence in testing for diseases of regulatory concern. So our regional non-lab is the U of M. So typically samples are collected and driven to the U of M VDL for testing. Samples are also collected and sent off to our foreign animal disease diagnostic lab in Plum Island. So they go off usually overnight to Plum Island. Meanwhile, they're being run right after delivery at the VDL. And usually our diagnostic lab is excellent at getting those results to us within just a few hours. Then we breathe a big sigh of relief if those are negative for foot and mouth disease or positive for Seneca virus, but we do still wait for FADDL lab confirmation in 3 to 5 days. It can be longer depending on the priority and the caseload at FADL. Nationally, we do a lot of swine vesicular FADIs. We first sort of got this virus on our radar in 2015, Seneca virus, and then since then we've had sort of an explosion of swine vesicular investigations. This year, this past fiscal year in 2022, we did 1,277 swine FADIs nationally. So we've had a lot of practice and experience with these swine vesicular FADIs. And over the past several years, we've identified some risk factors for pigs that might be higher risk for developing vesicles. There's been a lot of data analysis and epi investigations into why certain populations of pigs seem to be more affected. And the common denominator is extended time in slaughter channels. That might be a confusing or unusual term for you, but some pigs don't just go straight from the finishing barn down the road a couple hours to a slaughter facility. Some pigs go from their farm of origin. They might go through a livestock market or to a buying station where they can be commingled and then put on a truck, and they might go to another facility where they're commingled before they eventually get to their slaughter destination. And then cull sows are another population of pigs that travel long distances to slaughter. So the number of cull sow facilities across the nation is limited. So oftentimes sows from like Minnesota, Iowa, they're traveling longer distances before they reach their slaughter destination. So anytime over 24 to 48 hours in a slaughter channel puts you at a much, much higher risk for developing a vesicular disease. Pigs in these two groups account for 86% of our swine vesicular investigations across the country. And the type of pigs that are usually in like the market to buying station regrouping category are typically what we consider or think of as non-traditional swine. So these are roaster pigs, backyard pigs, smaller production numbers, and they can be traveling to smaller slaughter facilities or like more niche marketing type facilities. So they spend a lot of time on the road and commingling with pigs that they haven't grown up with. As you can imagine, this makes a lot of work for USDA and our state partners. And USDA Veterinary Services and our Strategy and Policy Division have recognized these trends over the last several years and the risk factors that contribute to a swine vesicular disease investigation. We also recognize the big strain and contribution to workload that these FADIs put on our stakeholders. They affect the continuity of businesses at slaughter facilities. We put a lot of strain on our state and federal field staff, calling them away from their regular duties to go out and do these FADIs. That being said, we do not want to miss foot and mouth disease detection in the United States. So starting in 2019, USDA Veterinary Services started a pilot project to determine if we should transition the current swine vesicular investigation process at specific high incidence plants with previously diagnosed Seneca Valley virus to more of a monitoring approach and removing that requirement for a foreign animal disease investigation. So cutting back on the number of steps required to get those pigs slaughtered and cleared for market. In 2022, this pilot program was adopted as a long-term policy. So I'll be talking about what that means going forward. So the goals for this updated approach are several-fold. We need to continue to investigate every swine vesicular lesion report that we receive, especially ones at these high incidence plants. However, we need to maintain the continuity of business for these slaughter facilities. Oftentimes, the individual affected pigs or even the whole lot of pigs that came in with affected animals will be held. And that causes backups at the slaughter facilities who are often tight for space and staff and everything already. We want to reduce the number of FAD investigations and submissions that go to the federal lab. Staffing is really limited there, so they do use a lot of resources testing pigs that we know are already positive for Seneca virus. And then we also want to reduce the strain and resource demand on our stakeholders. This can be a very stressful event for producers involved, slaughter facilities involved, and then it puts a lot of workload stress on our state and federal field staff. So options for high incidence facilities, there's a pretty strict criteria for meeting the definition of high incidence facility. And our facilities in Minnesota currently do not meet this threshold. So even though it feels like we do a lot of FADIs, we're not classified in the high incidence rate. So these individual slaughter facilities would have to have 3 or more days a week with an individual FADI initiated over a 4-week period. So 4 consistent weeks with 3 or more investigations. That's a pretty substantial amount. And in those cases, the area veterinarian in charge can request to the swine staff that this facility is added to the high incidence establishment list. And that's taken into consideration by national swine staff, the local NALM labs, and the federal FADO lab. The AVIC can also request non-FADDs to collect the samples, so this reduces the strain on our state and federal field staff. So that would mean either the veterinarian at the slaughter facility or another person that's trained to do those sample collections could be doing that sample collection at the slaughter facility and not our FADDs. And the goal for this.
Dr. Reberg, you have 1 minute remaining for presentation time.
Okay, this is my last slide. Okay, so we would still continue to collect duplicate samples. All of these samples, so every swine vesicular case would still be tested at a non-lab, but testing at FADL would only be based on certain null results. So in the case where Seneca and foot and mouth disease were both not detected at the non-lab, any non-negative or abnormal results for foot and mouth disease, those would all be tested at FADL. And then a random 5% of all Seneca positive and foot and mouth not detecteds would be sent to FADL for quality control. This would also allow slaughter of affected pigs without a regulatory hold. So slaughter continue at these plants without holding anything up. And that's it. Any questions?
Susan, that sounds like a very accommodating process that we've done. I still am a little bit concerned that we get complacent. And I'm hoping that doesn't kind of take over and say, well, we got to keep the pigs moving. I'm sure it's just Seneca virus, you know, but risk and reward, I guess, at this point, I'm right. That was the only question.
maybe it is, but like, what's the risk to the balance of the pigs coming through a processing facility that are exposed to that health group? Obviously, it's, and I should know this, but the foot and mouth, is that a surface only disease, or is that gonna be carried out through the meat and the fluids within the meat, that if the other pigs that were coming in proximity to that health group, are they gonna be, that can become endemic?
So if we had any non-negative or abnormal foot and mouth disease results stemming from a slaughter facility, that entire slaughter facility would be placed under quarantine. So nothing would be coming in or leaving that facility. So the risk should be pretty low there, not impossible. Risk is never zero. But I would feel pretty comfortable in our quarantine and stop movement implementation that the risk would be as low as we could feasibly get it in the event that there was a non-negative.
Thank you.
I'm sorry, I'm gonna ask another question. Maybe, what's the rate of finding the vesicles at the slaughter plant versus learning about it before the pigs actually leave the farm? Is that where most of these are detected, that they get to slaughter and somebody said, wait a minute?
I'm putting up a slide based on Minnesota FADIs in the last several years. Minnesota is a little bit unique because I think we have a large pig industry and we do a lot of producer outreach. The pork board does a great job of passing information to producers. So in other states, a larger percentage of the investigations occur at slaughter facilities. And you can sort of see since 2019, our slaughter versus on-farm has shifted downwards. So most of our vesicular investigations are now initiated on-farm. And those are reported by the veterinarian or the producer in that production system. So I think that makes me feel a lot better that we're doing that outreach to producers. They feel, them and their veterinarians feel comfortable reporting vesicles. They know it's not a business killer. They know it's a 24-hour inconvenience in most situations.
Thank you.
Any other questions for Mackenzie? Okay, thank you for your update.
Okay, guys, so, yes, please turn your cameras in now, let's see you once we get the presentation up. So, I'm Veronica Bartsch for people who haven't met me before. I am the senior veterinarian that oversees the companion animal programs, as well as the rabies program for the Board of Animal Health. I have a group of 4 fantastic people who are going to give us an overview about some of what our programs do. So, Lisa, Betsy, Keela, not Jessie because she's sick. Please just turn your cameras on and say hello. And then let the presentation up to be good going.
You're muted, Betsy. Okay, I don't know. We can't see you guys, so, okay, we're just gonna get going. And share on Teams. It's very strange out here. All right, anyway, so we're gonna be talking about difficulties. That's just the corner of the slide.
Here, I hope you can share the right one.
Did I share?
Yeah, because it's showing something different.
Okay. Anyway, so the first couple of slides are mine anyway, so we can monkey with this and get it figured out. So we deal with small animals, but we have pretty big programs. Thank you. Yeah, so when you think about the companion animal programs with the board, you may think about our commercial breeders, our kennels, which are animal shelters. And in each of those programs, there's quite a few tasks and different things that my team does every day. For rabies, we again are the animal side for all of the domestic animal rabies exposures and case investigations. We do a lot of import work with our, so both domestic and international imports of dogs and cats coming into the state. We do all of the reportable diseases of dogs and cats as well. So, for a lot of this, our diseases and things we deal with are zoonotic. They require a lot of interagency cooperation. So we work with our colleagues at the Department of Health quite a bit. We also work across governmental agencies down on, to local municipalities and then up in the federal side as well with USDA Animal Care and the CDC. We have some very busy phone lines and emails as well. So we have a lot of contact with the public. We get phone calls and emails from veterinarians, animal owners, people who don't have animals, but have opinions on animals, rescue groups, zoos, breeders, you name it. We have probably gotten a phone call from them in the last month. So we answer a lot of questions about animal health, about regulations. We take a lot of complaints from folks and investigate them as well. So in the meantime, we continue to review, evaluate, and improve our programs as they grow exponentially. Just in the year and a half that I've been with the board, our programs have exploded. So we're always looking for ways to make it more efficient, different ways to train our staff, to educate the public and our stakeholders, and then to do outreach. And more. So my team not only is crazy busy with companion animals and rabies, but they all have other roles within the board as well. So we're a busy group. And I'll turn it over to Betsy.
Hello, everyone. Hopefully you can all hear me okay. So my name is, you can? Okay. So my name is Betsy Lampelius, and I apologize ahead of time if I talk fast, but I have a lot to say in a short time about something that I love. So I have worked with the board since 2007, and since then I have been in charge of the rabies program, but I've also been in charge of the scrapie program and regulated animal imports. But rabies is my priority, and it's very exciting. So never a dull day. I've had a dog that was quarantined that ended up in Alabama on a hunting excursion. So that owner received a fine for that situation. I've had a rabid cat that climbed up a dude and latched onto his neck and wouldn't let go. We've had a goat that the owner was very passionate about and ended up putting this goat in their tub while it kind of went through the process. And we have a video of it, and it's very sad and disturbing, but educational at the same time. And then the most memorable thing for me was I had a box come to my desk and I opened it and surprise, there was this big black horse head in it. And that probably should have not come to me. It was supposed to be tested. So I'm going to talk a little bit about where that should have gone. So on my next slide, this is basically the team that we work with for the surveillance program. The first one there is a veterinary diagnostic lab, and that's where this head of this horse should have gone. So the veterinary diagnostic lab prepares the brain, puts it on a slide, then they ship it off over to the public health lab at the Minnesota Department of Health. They do all the actual testing, and then the results get shipped out to the Minnesota Department of Health Zoonotic Disease Unit and the Board of Animal Health. And the Zoonotic Disease Unit does all the human exposure investigations to find out if there was any human risk at all. And the last one there, the CDC lab, that's their headquarters in Atlanta. And we sometimes will send inconclusive samples to them when we want a further diagnosis, because they have a much more sensitive test, but because it takes longer to use, we can't use it on a regular basis right now. So we do contact them as for rabies testing. So the next slide basically runs through what happens on our end at the Board of Animal Health. So once we find out about the results, I'll take all the information and enter it into our database. And then if there's any animal exposure, I will follow up with people, or I'll send it out to the field vet if it's a skunk or a positive animal. They'll do an investigation. We'll talk to the owners and figure out what do we need to tell them for their animals, make recommendations. Sometimes that involves a quarantine. Sometimes it's recommending euthanasia. It kind of depends on the situation. And then we use all that information in the database to compile stats to see how our program is running and how the rabies has actually changed over time. So that's the next slide. So this shows what's happened in wildlife over the years. It's a map of the decades, basically. And you can see way back in 1980s, there were lots and lots and lots of skunks. That was about 1,500 skunks. And those are both positive and clinical signs that vets have determined they think they have rabies. So it's kind of a combination of that. But over time, it's come down. And I would attribute that to the decline in skunk population. They're considered endangered now, so there's not as many. We do still see them, just not as much. And then the bats have kind of gone up and down. A lot of people submit them, so we still get quite a few tests for those. And then on the next slide, you will see a similar trend, but that is with domestic animals. So on the bottom there is cattle, and that I attribute to the fact that the skunk population has gone down, and so there's not as many skunks going into the herds and biting cattle and infecting them with the virus. And then the dogs and cats are there on the top, and they have come down as well. And that's probably mostly due to vaccination. A lot of dogs and cats are getting vaccinated now, and that has also contributed to eradicating the canine type of rabies in the US. And that still exists all around the world. It's still one of the leading deaths in third world countries, but we don't have it here anymore. So it's a very valuable change, and that's contributed big time to that decrease in rabies over the years. So this basically shows how does rabies work over the year. Rabies season to us is August. That's when we see the most cases. And this year has been very weird because the temperatures have been higher for a longer period of time, and then a high temp can affect the specimen sample, and it can affect circadian rhythms, and the animals come out more during the day. And so we see more cases. And we've had about the same amount of cases both 2022 and 2023, if you look over from September to September. But it's just been extended over a 4-month period as opposed to a 1-month period. So thought that was pretty interesting. So the next slide is kind of an overview of what we've seen in the past year. And again, that's September through September. And when I ran the numbers, we had 37 positives, most of which were bats. And then there were 11 bats that were equivocal. And equivocal is basically the lab can't call it positive, but they want to. So we handle those as though they're positive. And then inconclusive are ones that they obviously couldn't get a good result out of. But 4 of those were skunks, and we handle those as positive anytime a skunk comes through that's not negative. So there are 197 total cases at the time that I took these numbers. There's been like a couple more since then, but. So this slide is showing the investigations per year. As you'll see, the number's the same. So 197 investigations. The Minnesota Department of Health investigates them all, and they determine human exposure, and then they ask about animals. And of those, 123 were handled on the Board of Animal Health side for animal exposures, and about 90 some were handled by us in the office. So whether myself or if I'm not around, then I've got Lisa and Veronica helping me out with those. So we're very busy, hence the beaver. But beavers aren't known to get rabies here, so it's not for that. It's just it does happen, but not very likely here. So this is final slide is of a graphic that's on our website. It is interactive. It's awesome. It allows people to go out there and see where rabies is in the state and that it actually is in the state. There's still people that aren't quite sure about that. Is rabies still there? And it is, and it's widespread. It's concentrated more in the cities. So Hennepin is the darkest one there, and most of those cases are bats, and we see that every year in Hennepin. And then the other two a little bit darker ones are Morrison and Stearns, and that's kind of a similar situation. We see some cattle in those as well, and some skunks, but a lot of bats. And then as you get out in the outskirts of the state is when we start to see more of the rural situations with the cattle and the skunks. So it is around in the state. So it's a very vital program, and I enjoy it. So that's all I have.
For Betsy? Sure, Betsy, we have a question for you.
Why
Yes.
why kind of county the most, or like the heaviest populated for rabies cases? Is it just that there's more people, or what's the reason?
Yeah, in general, that's pretty much it in a nutshell. So there's more people, and a lot of the housing, whether it's older, there's a lot of older homes there, and bats can squeeze in through smaller spaces than mice can. And so it would surprise a lot of people how they're getting in, and they'll be in their attics. And because they come into the homes and people are finding them, they're catching them. And MDH has this awesome video on YouTube about how to catch these bats. And so people are more educated on how to get them, and more education on the fact that they should be submitted if they're in the home. So more people, more exposure to bats, and more submissions is what has led to that. So yeah, absolutely.
Thank you.
Sure.
Kayla, if you're talking, we can't hear you.
No, I was just making sure there weren't any other questions. Can everybody hear me okay?
Yes.
Okay. So hi, everybody. I'm Kayla Pearson. I'm the lead program administrator for the companion animal programs. I'm going to be talking about the commercial dog and cat breeder program, kind of our elevator pitch, to stay on time, and because we could spend many more hours talking about this program. Next slide, Veronica. So a little bit about me. I've been with the board since 2012. I originally started in the cattle programs, and then when the commercial dog and cat breeder law was passed, I kind of jumped over and helped with that program because my background is more in small animal veterinary clinic settings. I am a program lead for commercial dog and cat breeder program, the breeder excellence program, our kennel program. I also handle the companion animal complaints and investigations. So I review all of those that are submitted to us to verify if there are potential allegations we need to go and conduct investigations on or not. I also work with Veronica and the great staff at the Department of Health for positive canine brucellosis dogs, and help send out investigations for that. And then I also assist Maya Walker with the compliance program. So the commercial dog and cat breeder program, or the CDCB as we often refer to it, passed in May of 2014. In July 1st of 2015, a commercial breeder had to obtain an annual license from the Board of Animal Health. And I just put the definition of the commercial breeder up there in case you're not familiar with what it is. But basically, the board licenses any dog or cat breeder that has 10 or more sexually intact adult animals. And by adult, we consider them to be over the age of 28 weeks or older. And those animals have more than 5 litters in a year. So this new law or newer law, it doesn't apply to every dog and cat breeder in Minnesota. It just applies to a specific parameter of breeders that meet that threshold for number of adults and number of litters. So for licensing requirements, there's kind of 2 parts to it. So we have the pre-licensing inspection. So that's for any new applicants that the board receives. They have to submit an application. They verify some certification statements at the bottom, and then they're required to pay a license fee. So that can vary from $10 up to $250. But it does not exceed that. So it's $10 per adult up to a maximum of 25 animals or $250. There is a pre-license inspection then that is set with one of our Board of Animal Health field staff members, where they meet with this breeder. They go over the requirements of the program, conduct an inspection, and then kind of educate them on what the program is and what the requirements are going to be for them going forward. And then we also require each breeder to work with a local veterinarian to establish their veterinary protocol. So this has to be signed and reviewed every 12 months by the breeder and the veterinarian. So this establishes a working relationship between the breeder and the veterinarian. And it outlines things like disease control and prevention, and standards of care and what to kind of do in an emergency situation at their facility. And then once that breeder becomes licensed, they kind of fall into an annual licensing inspection, which again, they will be inspected every year. They have to submit an annual report for their license renewal. And that is just a 12-month number range of the number of puppies they have, the number of adults, and the number of animals that they sell, as well as brucellosis test if they are still sexually intact and over the age of 28 weeks. They pay that license renewal fee, which is the same, so $10 up to $250. And again, they have to renew that veterinary protocol with their vet. So part of the inspection, there are 26 points that our field inspectors go through each time they're doing these inspections. So I just kind of highlighted the 5 main points, and underneath these there are more. So facilities, for example, they're looking at lighting, ventilation, and sanitation. Standards of care, it'd be like food and water, shelter size, enrichment, identification of animals. It looks at how they identify their animals, making sure they're not reusing like numbering sequences or naming on animals for each litter or whatever, that there are unique records. We're verifying that they have records on all of their animals. So when they're born, if they come into the facility, when they leave their facility, any vaccination, treatments, protocols, things like that. And then again, our inspectors are reviewing that veterinary protocol just to make sure that it is being completed within that 12 months and it is filled out completely. And then just to mention, in order to pass an inspection, the facility has to pass all 26 inspection points to maintain their license. So we just don't have, field staff get 24, 20 out of 26 points and say, good enough, we'll see you next year. Our inspectors work with those breeders to get those deficiencies corrected and to maintain that the facility is still in compliance with our requirements. And then because everybody loves numbers, we just kind of pulled together a few here. So as of June 30th of this year, we had 107 licensed commercial breeders. And from July 1st of last year to June 30th again of this year, we added 8 new breeders to our list. And then we also have 3 breeders currently enrolled in the Breeder Excellence Program. So this is a program that highlights breeders that kind of are going above and beyond the minimum standards that are required by the Commercial Breeder Program. This program was created using a task force made up of Board of Animal Health staff, veterinarians, and then licensed commercial breeders. They met for about 2 years and then came up with the requirements or the badges for this Breeder Excellence Program. So as you can see on this slide here, there are 6 badges over on the right. So there's a Behavior and Socialization badge, a Continuing Education badge, Facility Management, Canine Brucellosis Screening, and then for our cat breeders, because they don't test for canine brucellosis, they have the FELV and FIV screening, and then the health screening badge. So a breeder can apply for one of these or all of these, depending on what they want to do. And then if they earn all 5 badges or the badges in blue, we give them an overall Breeder of Excellence badge, which can be seen on the left. This is a voluntary program, so it's up to the breeders to determine if this is something they want to do or not. And they do have to reapply for it annually to earn the badges again for the following fiscal year. And then, because again, we were given a very short time to talk about this program, there is additional information on the board's website. If anybody is curious about that, or also if you want to go into more depth, we would be happy to come back and speak at another board meeting in the future. So thank you.
All right, so I have to be Jessica today because she has lost her voice. So
Can I ask you a question about the breeders?
Yeah.
Okay.
we have a question about the breeders.
With the excellence, can that only be earned by the breeders that have 10 or more animals as well, or could somebody who has less animals?
It's just for our commercial breeders.
And why do you think there's such low enrollment in that?
I think some of it is, they don't know about it. So when Kayla and I went to the Minnesota Pet Breeders Association meeting last spring, we did a presentation on it and gave out a lot of information and a lot of informs. And so we've had more interest there. So I think we need to educate a little bit more and let them know that, you know, these aren't kind of astronomical things that we're asking them to do to earn these badges.
Yes.
Tyler, illegal breeders in Minnesota, and we saw who looks for that, who looks for people that illegally breed dogs.
Yeah, and so we don't, at this time, you know, the board doesn't have the capacity to go out searching for people who are operating without a license. A lot of our official complaints that we get in from the public are concerning breeders and potentially people operating without a license. And every complaint that we get in, we investigate, and that is in statute. So we're obligated to do every single one. So we find people that way.
I just wanted to add to that, Veronica, that when this program first took effect, we were trying to go out and search. We were using health certificates, we were using websites and Facebook. And unfortunately, that wasn't really proving a good use of our time, and we were finding dog and cat breeders, but a lot of them didn't meet the threshold at that time.
Who designed those beautiful graphics for those badges? Oh, bad.
Cornille was asking about the beautiful graphic.
Aaron
Those are Aaron Kreider's handiwork. So thank you to Aaron.
Any other questions about our breeders? All right, so this is Jessie, when she doesn't have COVID. She joined us at the board last October, and I'm very happy to have her. She is an office and administrative specialist. Her duties include canine influenza. So she did all of our data management and case management for canine influenza. She processes CDIs, so all of our companion animal CDIs that come in, she's looking at making sure that the veterinarians are accredited, that they meet the time limits and have all the vaccine requirements. She also is the brave person that answers our phone and checks the email. She also has job duties with the farm servants. She does the mail in the office, and she also does work with the National Accredited Veterinary Program. So as part of her duties answering the phone and looking at our email, she's the first person that touches our reportable disease case reports that come in. This is just a list of the companion animal reportable diseases that we deal with. So we, again, a lot of these are zoonotic, and so we work hand in hand with the Department of Health. We have a lot of information on our website about the reportable diseases, so not only a complete list, but information about the diseases themselves. We're also working to get online case report forms to help ease the process of disease reporting. So in April, I talked a little bit about canine influenza as we were just going into an outbreak that ended up being quite large. So Jesse summarized canine influenza again on this slide. So it's our type A influenza virus respiratory disease. There's two main types, H3N8 and H3N2. Unfortunately, with our outbreak, H3N2 is the type we were dealing with. It tends to cause more severe disease, and animals that are infected can shed the virus 28 to 30 days, even if they have resolution clinical signs. So we have dogs running around shedding virus for a month. So our first report from the animal shelter was on the 6th of April. Our first owned animal confirmed positive case, a report came in on the 13th of April. From then until just a couple weeks ago, we had a total of 110 confirmed positive cases. 6 of them were in the shelter. So this shelter had 196 suspected positive dogs. So they got, in that initial part of the outbreak, they got 4 positives and they stopped testing because they were under quarantine. We were under the assumption that anybody who had upper respiratory or had respiratory disease in the shelter was positive. So they stopped testing at that point. The 6 confirmed positives comes from 2 new cases after that initial outbreak. So and 104 of our total 110 then were community pets. So these are owned animals out in Minnesota. Our last confirmed positive case was on the 19th. I do think that now that we've had, this volume of influenza in the state, I think this is going to be a disease that we're going to see. Hopefully it'll be in low numbers and we won't have a large scale multi-shelter outbreak like we did. So this slide has our epi curve. So you can see when the outbreak started in April, we really peaked around Memorial Weekend in May. Coming back after the long Memorial Weekend, we had 40 plus case reports sitting in the email box. So it was a lot of quarantines to send out. And then we've seen that that curve go down as we got the word out about quarantining and isolating dogs, and the vaccine manufacturer was able to ship vaccines to Minnesota. All in all, we had 10 counties in the state affected. So the majority of our cases were in the metro area, with Hennepin having 82, so the highest amount. But we did see some positive cases in greater Minnesota as well. So each non-negative test result, veterinarian is required to submit a case report. Again, we very quickly made this an online form. Jesse worked very closely with Michael Cruzan in the communications department one Friday afternoon when I unfortunately was out of the office. And she pulled this together. They pulled this together really quickly and got this going for us. It's fantastic. For every non-negative test, we quarantine that dog and all of the other animals in the house for 30 days from the date of sample collection. And we do that because we know that this virus can be transmitted via fomites. So it can be on fur, it can be on shoes, it can be in carriers. And so we really wanted to stop the spread pretty quickly. We send that official quarantine document to the owner via email. Along with some other documents and some heavy questions that we then, Jesse puts into a database so we can look at trends, figure out who's getting sick, where they're getting sick. This was really helpful during the outbreak because we were able to identify specific dog businesses and, down to neighborhoods that we could really target our efforts then to get this contained. Jesse then calls every single owner of a dog with a non-negative report to make sure that they understand the quarantine, that they understand the disease, see if they have any questions for us. Great. Lisa's going to talk about imports.
I have a question. Oh, what happened with positive case in a daycare, for example? In a daycare facility that, where taking those animals there.
Yeah, so we quarantine, if there was one positive case in a daycare, we quarantine that animal at its residence. And then I was contacting all of the dog businesses that had a confirmed positive case and walking them through increased biosecurity, helping them with contact tracing. So we gave them documents that they could send out to other dog owners that were there and potentially had exposures. We don't regulate dog daycares and dog businesses, and so we could only provide guidance and hope that they followed our suggestions. And really, we had a great response. The dog businesses knew that they were probably one of the higher risks, and so they jumped to action pretty quickly and had some good biosecurity. Anything else on influenza or other referral places? Oh, Lisa, you have 2 minutes.
Hello. Can you guys hear me okay?
Yes.
Excellent. My name's Lisa Elin. I came to the board in 2019. Before that, I worked at the Veterinary Medical Center at the university for 15 years. I've been in both small and large animal and been in the industry for probably about 25 years. At the board, I'm in charge of the companion animal import export traceability program. We do quarantines for specific diseases there. The ovine progressive pneumonia certification program for sheep and goats, and the brucellosis tuberculosis certification program for sheep and goats. I also help with the server department and the diagnostic invoicing and reconciling. And I am also have the honor of being Betsy's backup for rabies. The girl knows a lot of stuff and she's great about teaching me. Let's go into a little bit of the animal statistics. So according to American Pet Producers Association, for 2021-22, 70% of US households own a pet, 90.5 million homes with furry friends, and 78% of these American pet owners will travel with their little furry friends each year. So you got to think, okay, out of that, how many animals are coming into Minnesota? So I pulled up data from September of 2022 to September 2023. 15,593 domestic dogs that came into the states, rescue to rescue. There was about 7,900 international dogs, 76 came into Minnesota, and we quarantined 52 of those. For cats, about 3,300. Rescue to rescue was about a little over 1,900. International into Minnesota was 38, and we quarantined 18 of those. We did quarantine those for African swine fever and a couple other things. Let's go into the import requirements for what are required for Minnesota. So you need a certificate of veterinary inspection. That's for domestic and international. Proof of current rabies vaccine if over 12 weeks of age, or a pet passport for domestic and international. All of the certificate of veterinary inspections are examined and approved if they meet the requirements. They need person's name and origin, purpose of movement, rabies info, person's name and destination of where they're going, animals info, and the vet signature, license number, and date. If any of that criteria is not met, we do communicate via email, phone, requesting all corrected documents, and we do stay connected with them until we receive everything and it meets everything. We also work closely with the USDA and CDC to help cut down on diseases that could potentially come in to Minnesota. Some of those that we watch for are screwworm, foot and mouth disease, rabies. We monitor entries from high-risk rabies areas. Excuse me. We work with the CDC and they send us copies of all the permits that are requested from high-risk areas that are coming into Minnesota. So we follow up on all those. And African swine fever. We do have a 10-day quarantine of all cats and dogs coming from countries that have positive cases of African swine fever in or near it. So African swine fever, it's highly contagious disease of domestic pigs, or domestic and wild pigs. It's been found in multiple countries worldwide, including Asia, Europe, and the Pacific. In 2021, it was reintroduced into the Dominican Republic and Haiti, the first detection in North America in 40 years. The virus is highly resistant to the environment. It can survive on clothes, boots, wheels, and other materials. Ticks can carry and transmit it for years. If it's brought into the U.S., it could potentially cripple the U.S. pork industry, which is annually valued at billions of dollars, since the presence of only one ASF-infected pig usually results in the swift culling of the whole herd. A lot of people wonder, well, this is a swine disease. Why are we taking these precautions? Well, it's true that dogs and cats can't get infected with African swine fever. So why are we taking all these precautions? Well, it can be spread by the fur and the coats of animals, can be spread by the bedding, the kennel, the food dishes, can be spread by contaminated pork eaten by animals and be present in feces for 7 days. The virus is highly resistant to the environment. As I said, it can survive on clothes, boots, all materials for up to 8 days or more, depending on the temperature where it is. For the 10-day quarantine for African swine fever, known travelers with pets that are coming from an area where there have been positive cases of African swine fever in or near it are subject to the 10-day quarantine. During the quarantine, the animals must complete a checklist that includes working with a USDA or a BA field rep to complete a checklist with verifying pictures. They have to bathe the dogs, examine for external parasites, apply flea and tick. Even if no flea and ticks are seen, it must be purchased and applied in the US. Any applied before entry is not valid. Dispose of transport associated animal materials. Goodness, that was a mouthful. Bedding, food, and treats. Clean and disinfect non-disposable items with a combination of bleach and water. Mainly like the kennel crates, dishes, whatever. And then the items need to be in bleach solution for 10 minutes to really be the best effect of it. Any movement off premises needs to be permitted by BA, and quarantines can only be released once everything is completed and verified. And I think that was it. If anyone has any questions about the quarantines or the ASF, anything like that.
Where is the quarantine on the airport? or international dogs or?
No, the quarantine takes place in the owner's home.
Yeah, in the owner's home.
Yes, yeah, so, so this is a state-specific regulation. So the USDA has similar, regulations on dogs and cats coming internationally, from ASF, high-risk countries. Only if those dogs are coming in for resale or adoption. So the rescue groups and breeders that are importing dogs. Because there isn't a federal equivalent for owned pets, we don't do any quarantines or we don't have any operation at the airport itself since that's all CBP, USDA and Border Protection. So all of this happens at the people's homes once they can hear this.
I have one question.
Yeah.
It's an applied flea and tick, even if no flea and tick are seen. So are you only accepting topicals or can they also do the?
They can do oral too.
Okay.
We generally see topicals because folks are just coming into the country and don't have vet here.
Okay.
So, sometimes we get the orals if they have to go to the vet because of the CDC rabies requirement, but otherwise.
So since that way, and it doesn't have to be veterinary groups, like they can go get like parts brand and then you're considering that okay?
Yeah, we look at as long as it's approved by the EPA or FDA, for the killing of ticks.
Interesting.
So there is no real way to make sure that these people follow the quarantine, right? If they are doing it at their own home.
So we have, our field staff, they do these virtually, but we do require, photographic evidence that they're doing all the disinfection and sanitation and application and tick. And then, yes, I mean, we're not, again, we don't have all the resources to sit outside of everyone's house and make sure they don't leave with their dog. But we do have, our field staff checking in with these folks and attending and issuing quarantine releases. Yeah, we've had a few, bumps along the way, with compliance with this program. That don't, are coming from countries that have positive cases, but that USDA considers at risk. But generally, people are really amenable to following our rules on this. It's just 10 days. Anything else on imports or ASF incidents? It is. We think that we're going to keep growing and just need these paths. Right, thank you. Thank you.
You're in the 2 o'clock, the hardest time of the day for presentations. All right, so again, I'm Dr. Cornille and Senior Veterinarian, joined the Board of Animal Health this February, so just after your last meeting, so it's nice to finally get to meet all of you. Like I said, I cover the bovine disease program, animal disease traceability, and then my other program is livestock concentration points, which we're going to go over today, just an overview of what we're doing, what's keeping us busy. So I'm just going to do a high level overview and give kind of some basics of what, that program means. Livestock concentration points, meaning places or events where large numbers of livestock are going to be concentrated at one premise. And then talk a little bit about what's going on this year since I started, and then what kind of we've got plans for the next year. So some definitions to keep in mind. So how we technically define a community sale is going to be public sale of livestock or poultry, and that means 2 or more persons who own livestock are offering livestock for public sale. And then our definition of an exhibition is livestock or poultry owned by 2 or more persons brought to one location for judging or display. Some other livestock concentration points that I won't be emphasizing as much, but there are also buying stations. So that's when livestock are bought and sold and assembled for shipment for a packing plant or a public stockyard. And then slaughter and handling facilities. We have about 3 of those that get annual permitting inspection. And so those receive and handle cattle, to be released only to a slaughtering establishment that's USDA FSI's inspected federal establishment. And then the last thing being our accredited veterinarians. So those are veterinarians accredited through USDA APHIS to perform functions that are in the cooperation of Board of Animal Health and USDA interests. And so when we refer to official veterinarians at Board of Animal Health, our current definition of official veterinarians, they have to be accredited veterinarians. So I'm going to be mostly covering sales and exhibitions. So for sales, we have, kind of one-off sales events that occurs, maybe annual events that occur, or we also have our auction markets. And then exhibition, the primary categories being, our shows and then all of our county fairs. So going kind of into community sales, so just so you guys know what we expect of them. I don't know your baseline knowledge, so I'm just going to cover some of the basics, but they are required to receive a permit. So those one-off events are going to apply for a permit online. And I think just since June, we've probably, oh no, that's exhibitions, never mind. I don't know how many we've had this year, but, and then sales that are held annually and those livestock auction markets that occur, every Monday, Wednesday, Friday, from this to this month, those permits are issued annually. These events are required to have an official veterinarian, and also we have requirements around the facilities to make sure that they're, safe and clean for animals to prevent the harboring or spread of disease. And then there are some additional requirements for state federal markets. So an auction market can be, kind of state permitted or a federal market, but most of them are going to be state federal. So they're kind of encompassed by both. And then we have requirements for the sale managers, so they can facilitate that all the requirements are met at these events. So also under the official veterinarian that's there, they have a myriad of duties, but their primary duties are to verify, health and movement requirements, write any certificates of veterinary inspection, write any exports needed, verify and apply official identification and record any official identification applied, or, any removal of official back tags or with things within slaughter channels. So they play a really important role as well. And then there are some exceptions for poultry only sales. The poultry are still required to have, certain testing done, like the florid typhoid cells, as well as, certain identification requirements for different species of birds and different poultry. But a veterinarian is not required to be at those events. And then also we monitor the use of affidavits, and those are part of their record keeping. And we currently allow that affidavits are used to move breeding cattle to other state federal markets or within slaughter channels from approved state federal livestock markets. And so what kind of the federal side on this, I'll only touch on it since out of our jurisdiction, but livestock markets go under approved livestock facilities. So when they have that state federal jurisdiction, they just have, a few extra requirements they need to meet with USDA. So when they come on, they need to do a federal agreement form, and any changes that they make in terms of days of the week or species they do, they're going to have to resubmit that. What they have to do for the Board of Animal Health is they do need to annually do application, and they complete this with our Rabies field staff. They also, if any veterinarians are going to be applying official ID, are going to need to complete a tagging site agreement. And then also if they have any annual slaughter affidavits, so if there's any kind of ongoing agreements between a market and a slaughter facility, that's a little bit more streamlined and still on record. So they renew annually with us at the turn of our state fiscal year, and they're also required to kind of receive inspections from our field staff to make sure they're, meeting those requirements, and so our field staff can, be a point of contact and help them. So a rundown of kind of our markets. We have the 21 state federally approved markets, and then one that's state only approved, I believe, but these other markets are kind of scattered throughout the state, and those are our auction markets where we see a lot of animals moving. So kind of moving on to exhibitions. So permit is required for each of those, and the manager of the exhibition of the event is going to, there's a form to complete online, which is pretty easy. I think just this summer since June, we've had 61 exhibitions, not including county fairs. And then county fairs, we have, I think, 93 of those. There's a county that does 2 and it's split up. So there's a lot of permits going through. So a lot of permitting to make sure that our field staff are aware of the events and can perform their inspections. And so that definitely keeps us busy in these summer months, just from, you know, kind of a paperwork standpoint, verification standpoint. There are some exceptions to needing a permit. So horse shows that only last a day, no horses that are stabled overnight are not required to have a permit. And then standalone rodeo events, I say standalone because if it occurs within a county fair, it's considered part of the county fair, so it's still then subject to those exhibition requirements. And then horse races licensed by the Minnesota Racing Commission, they take care of a lot of that stuff, and they have their own requirements. And then the managers of these events, whether they're, you know, the fairgrounds managers or a separate association manager. So their duties, a main part of it is to acquire the permit, and when a permit is required, that they acquire a veterinarian that will be able to perform the required duties for this. And there are, you know, other requirements in terms of record keeping that we have for sake of traceability and whatnot, so that in the event we needed to, we could gather the information we needed. So then our official veterinarians, they have, you know, they play an important role in these livestock concentration points because, you know, they're considered higher risk events with all these animals from a bunch of different people coming to one place. And when we say official veterinarian, like I said, accredited, but we allow that they be category 1 or 2, category 1 being mostly small animal, but we allow, you know, veterinarians that have that expertise in either category to perform these duties if they agree to and feel comfortable doing so. And the times when an official veterinarian must be present at an exhibition are the day that animals are admitted, and then once daily for health checks. They do not need to be present for the entire event. They do not need to be present the entire time animals are there. They need to kind of essentially check in animals on the day that animals arrive, which, you know, sometimes can span over days depending on the event. And then once a day to, you know, just do health checks and make sure that there aren't any, you know, emerging vesicles or what have you. So as part of that permit application, it lists the veterinarian's name, and to kind of protect veterinarians in that, we make sure we do reach out to the veterinarian to make sure they have agreed to be the official veterinarian for a given exhibition. So that when the permit is issued, that everything's kind of good to go and our field staff can go out and inspect and also, you know, help as a point of contact. So, and they, similarly to at sales, the veterinarian does have, you know, a lot of responsibilities that they are to their, you know, accreditation and their licensure, that they are verifying, you know, that there's no obvious sign of infectious communicable disease, and that animals are appropriately identified and paperwork is in order and all that good stuff. So kinds of things that veterinarians are looking for at these kind of events are, you know, making sure that, you know, no animals with diseases of public health concern or zoonotic concern, or just general reportable diseases are entering, and that anyone that is found is, you know, quarantined or removed. So I think at the state fair this year, I'll echo what Joni said in that I think everything went pretty smoothly. I think any animals that were turned away were for, you know, ringworm or soremouth. When I was there wasn't really anything in quarantine, and thankfully now the quarantine area at the state fair is a nice separated area from everything else in case, you know, people aren't able to bring their animals home right away. I think everything else was pretty smooth. I know one barn had an issue where the cleanup crew kind of, dipped out early, and so, you know, then the veterinarian having to verify the sanitation and whatnot, that creates a little bit of a challenge, but then, you know, the next, switch over of animals went a lot more smoothly. But that was just kind of the one small challenge that I observed, and as always, with these events, you know, the main questions we get are surrounding official identifications. There are the federal standards, which is mostly just what we hear, and they can get a little convoluted by species, and we still get a lot of questions on those. And then, so what's kind of been new, 2023 here at Board of Mental Health. So I guess I don't know how long I can call myself a new guy, but I've been in about 6 months. And then we have also this summer promoted Nancy Reek. She's on vacation right now, but as a state program administrator, so I lead a team of 4 with all my programs, super all-stars. Nancy's the one that primarily is going to be dealing with the livestock concentration points program, so all of the permits. So the fact that we usually have a pretty quick turnaround time on those is pretty impressive. So if they're slower over the next week, it's I'm doing them, so sorry. We also have a general inbox where you can, you know, send questions about all these programs, get in touch with us or send resources, or I'm always open to receiving these like ideas and contact and whatnot. Also I've kind of re-implemented on the market side a market working group, so that involves both APHIS and Board of Animal Health, field staff and office staff, so we can kind of work through some of the challenge points of our markets, which are, you know, some really challenging from a traceability standpoint and can be some of those higher risk areas. So we're trying to slowly, you know, tackle maybe the opportunities for growth or challenges we see in those areas through that group. Also been trying to put an effort on outreach. So I've done a few field visits. Also did kind of one regional meeting with fairground managers to see if that would be a good way to educate fairground managers on our expectation and help provide resources for them. I also did a webinar for veterinarians, and turns out when you offer continuing education credits, people show up. So had about 75 veterinarians attend that, which was great. And then also held a webinar for managers and had about 15 attendees to that. Brandon was taking over the program in March. There wasn't a lot of time before the season. So this was kind of a little bit of a litmus test and kind of testing out what kind of outreach activities are going to be successful to make, you know, next summer even more successful. So just because, you know, the state fair is over and the season's over does not mean that the busy season is necessarily done for us, because I think there's a lot of work that needs to be done kind of in the off season to make it successful next year. And so the work we do now, I think, is going to make the biggest difference. So again, an emphasis on outreach to make sure the expectations for everyone are clear, and there's not, you know, a lot of confusion about that, and trying to find the best forms and modes at which to communicate those things, whether it be webinars or going out and doing more, you know, regional visits, meetings, printable materials. We'll be updating our exhibition handbook and really trying to reach out to more stakeholders. So not only like fairground managers, but, you know, thinking about our other stakeholders, FFA, 4-H, any other associations, to just try and help educate people and answer their questions. Like Rochelle had said, there is, you know, it's the time for reviewing rules. One thing that is, I think, going to be being maybe phased out is the sheep and goat exhibition requirements for scraping concerns that, you know, they have to receive essentially prior approval from me before they can exhibit any pregnant sheep or goats that are within 30 days of giving birth. And then, you know, we'll go through all of our other moves as well and look at where there are opportunities without, you know, sacrificing any animal health concerns. And then, you know, also taking the information we gathered from this year and the challenges we faced and kind of learning from those to see what we can do better next year and future years after that. So the main challenges we faced with our county fairs was official ID, and that's always a question. So, having, you know, the managers help their exhibitors fulfill those requirements. And, I think there were 17 compliance issues for the summer. Yeah, since June, there have been 17 compliance issues in livestock concentration points. You know, 1 or 2 at the markets, but that's mostly, you know, from a record keeping standpoint or movement standpoint. And then the rest of them varying between, you know, not acquiring a permit versus lacking official ID on animals. And those are the kind of main points that we can work on. And then, you know, the questions for the requirements for rodeos and petting zoos, I think it's slowly, people are, you know, kind of learning that in part of a county fair, you know, if you're there, you have to meet those exhibition requirements because all those animals are commingling. And so there's a little bit greater risk than all the animals that are just, you know, traveling together and owned by the same person. Another kind of primary challenge that has come up this year has been with the permitting of horse shows. So, you know, there's that expectation that any horse show that lasts longer than a day of horse stuff staple overnight, that they acquire a permit. And so we've had a few compliance issues that we've had to, you know, issue, you know, notices or educate people on the rules on, you know, that they need to receive the permit to have their event. And in talking with, in the few people I have engaged with, it seems that the main challenge for that is acquiring a veterinarian, because you need to list that veterinarian to apply for your permit, and we can't issue the permit without official veterinarian being assigned. So, unfortunately, you know, we don't necessarily have a lot of influence over the veterinary shortage, or that's not necessarily in our jurisdiction. And so we understand that that is a great challenge, but this will segue a little bit into what Heather's going to be talking about. But we have received a lot of feedback from the equine industry about the challenge of getting veterinarians to perform those duties at these events. Whether the barrier expressed to me has been, you know, cost or availability, or veterinarians not wanting to perform these duties. I've received various kind of feedback on, you know, why this is a challenge. So I think Heather will touch on what a few more things we're doing to address that, because we're hearing the industry concerns, but we also, you know, have to enforce the rules that we're charged with enforcing, and do so fairly and equitably, and just moving forward to see how we can better address people's needs while still, you know, addressing the need for, you know, animal health, and making sure that we don't make any compromises on that end. And that's what I've got for you. Did anyone have any questions on that stuff before we go to our final presenter for the day?
A couple of questions.
Yeah.
So it's out of curiosity. So we talked about livestock concentration points.
Yeah.
And in Europe, I know this from Europe, and I think here is the same. So there is a lot of transport of animals, cattle, for example, that cows move around a lot. So there is a law in Europe in which, so when these animals travel, they need to rest every, I don't know if it's 6 hours or 8 hours. They have to get down the track. So there are like rest stations or rest stops, rest areas for these animals. So these facilities are here or no?
Yeah, there are requirements here. Those are actually federal requirements under USDA, not just for cattle, but even for companion animals as well. We have regulations around duration of transport, and, you know, after this duration of time, animals need to get out and rest and whatnot. So there are those regulations. Those are mostly enforced federally.
But these facilities exist here in Minnesota?
No, I don't think there's, you know, stopping. I don't think there's rest stops.
Then when they rest, where they do it? If the cattle, for example, inside the truck, maybe?
No, they do have to, I think after like a certain number of hours, depending on the species, they have to get out of the truck. I can't say I've done much hauling in my day, but I don't know, I say it's maybe 50 cars.
So actually, so when we go across country, qualifying like another breeder, that's maybe halfway, we'll stop safe for the night on cattle or anything, and then we'll have it. Okay, next day.
So there are no businesses, no, that are, no, I say it because if your business exists, and if you like pathogens, and if you like disease, it's a great place. So they need inspection, so.
Yes.
But that's interesting, because I didn't know we have, like, rest stops. That's fun. Yes, snacks, yeah.
First, I'm sorry that I missed it, the CE webinar for vets,
Yeah.
is that recorded so that people back can watch?
Yeah, it is recorded. We have a YouTube link for that. Yeah, I can see if we can find a way to better advertise it on the site and also send it out to you.
That's great.
And that's also, it was kind of to see how people responded. So it's something that, since people seem to like it, that's something I can, consider doing annually. It was a little bit last minute this year, but, as I gain more and more information, I think, each year that can get more and more informational. So since it seemed helpful, I'll probably do it again this next year too.
And one other question.
Yeah.
Is the having category 1 and 2 because of the difficulty to find learners or, okay.
Yeah, no, that's the reasoning behind that, like, it's primarily to try and make accommodations where we can that still fit within our regulation.
In general, do the folks kind of get some guidance of what they're supposed to be looking for? Like, even if it was say a cattle vet and you're asking them to do a figure to know what to look for with rabbits, for example, did they get any kind of guidance on things to look for with other species?
But yeah, somewhat there's, a little bit of that within our handbooks and resources. But I definitely, think there are more resources, always we could make on that. I know also with accredited duties, accredited duties, there are some, outlined in the USDA CFR. But it'd be good to, look at, what other better resources are out there.
Any other questions for Kate? Thank you for your update.
I'm Dr. Heather Damico. I am the newest senior veterinarian, but I started with the board in 2019 as a field vet. And then I started as a senior vet in July in charge of cervids, horses, and chicken bones. So horses are part of our issues today with permits. And I just wanted to kind of go over an overview of why maybe it's a little, the industry is a little up in arms. So there's some different considerations that they would like us to look at and talk about and what we're doing with that. So just a quick view of some of the things that, why do we worry about concentrating concentration points for horses? Just like any other species, we have contagious diseases that can spread easily at horse shows. These are the main things that's off the top of my head that we would look for at a horse show to try to prevent with biosecurity or, preventing sick horses from coming in the first place. So EIA, equine infectious anemia is one that we have rules for Coggins testing. That's for Coggins testing. That's what that test tests for, is equine infectious anemia. We don't really have issues with that at horse shows. Most managers, to my knowledge, are pretty good at collecting those Coggins and checking and making sure everybody is doing their Coggins forms. So, so that's not, it's on the list because it is a contagious disease in horses, but we don't really have that issue at most horse shows. Equine herpes virus can go through shows, go through a population of horses pretty quickly. That's the picture on the right, and that is when it mutates, or there's two forms, but basically they become neurologic. It can also be an upper respiratory disease. Equine influenza, strangles, those are both also, upper respiratory diseases that spread really easily, and then warts. You don't see a lot of horse shows because it's unsightly, and usually you want horses to be pretty, but it is something that, is contagious. We have a lot of other diseases in horses that are spread by mosquitoes and all kinds of other stuff, but these are the main ones that go horse to horse in a show type situation. So obviously we want to prevent that type of deal. Horses in Minnesota, just as an overview, they have a large economic impact, you know, similar to any of our other animal industries. We all have an economic impact. So part of the argument is if they're having a hard time getting permits, they're having a hard time getting a veterinarian, it's going to impact the equine industry. We're going to have less shows and less revenue in all of those. So it's not an innocuous question, but that doesn't necessarily negate the fact that we still have the purpose of preventing disease spread in Minnesota horses. So the direct economic impact of the horse industry, this all comes from the University of Minnesota Equine Extension website. So our direct impact is 541 million and the creation of 15,113 jobs. So it's quite a lot. And then the total economic impact is $1 billion in Minnesota and with the creation of 21,039 jobs. I don't know exactly the difference between the direct and the indirect, but I'm guessing, you know, it has to do with how many people fall off the horse and have to go to the hospital maybe, or, you know, other things that are impacted by the industry in Minnesota, but maybe aren't owning the horse. So also it could have the households. There's a lot of people that don't own horses, but they still ride horses. They still go to the horse shows to watch the horses. They go to the horse expo. They take lessons. They, you know, they might own horses, but they manage barns, things like that. So there's a lot of people that are involved in the horse industry that don't necessarily own horses. And that, of course, impacts that. I had to toss one. I did used to be a horse vet. I did actually used to touch horses. So that's when I was still in practice. So I do have a lot of equine experience in my background. So this is, you know, something that I too am interested in. I was a horse vet for 10 years before I went to regulatory medicine. So some of the things that we're worried about being a shortage of veterinarians, we already talked about that. It's everybody, we're all aware of that issue. But again, it doesn't negate the fact that we still have this issue that we need to address. So is there some way that we can come together to help the horse industry, but still accomplish our goals? So we require a veterinarian to visit these exhibitions daily. And in rural areas, that's where most of these horse shows are held. That's where we have the biggest issue with finding veterinarians. I'm not using a microphone. Do I need to be? Am I loud enough?
Michael says you're loud.
Okay, I tend to be very loud. So, and then again, the category 1 or 2 accredited veterinarians that, you know, we're trying to help with this shortage. And we're still having the issues with finding veterinarians, but we're trying. So to try to address this, we've had a lot of calls, contacts from veterinarians, from horse show managers, from horse owners, from exhibitors. And Katie's done most of the legwork on all of that stuff with the permits and the exhibitions because that's her department. But I get to come in because it's horses. And we're having a listening session at the end of October. I believe the 24th is what we decided on, and we're using the Neutrina Conference Center at the Equine Center at the vet school. And we've invited just a panel of people essentially from different aspects of the horse industry. So we have several equine veterinarians, we've got people that are organizing shows, a couple of exhibitors, people that have, you know, been in the horse industry in Minnesota for years. Just to listen and see, do you have any ideas? What can we do? And then we have to figure out if we can do that, right? So it doesn't mean that we can, you know, change all the rules and get rid of everything. But I do think that coming together to try to see if there's some solutions that we can come up with and make this an easier situation, but still accomplish our goals. And this is just kind of the first step. So we're organizing this session and see if anyone has any ideas, and going forward from there. But there's also, historically speaking, there's some, the equine exhibitions and how we have some things that are different for them, you know, the 12-hour rule and things like that. I think over the years has kind of been misconstrued by the horse industry as in they don't need a permit. So there's also a lot of education that has happened where people didn't think they needed permits, but they do. And that's not a new rule. That's always been the rule, but I think people have been confused about that. So there's also a lot of that education going on and seeing if we can also educate horse show managers and things like that about how can we get more veterinarians and say you don't have to have, a lot of them think they have to have a horse vet. You don't have to have a horse vet. You can have a category 1 veterinarian. They probably have category 1 veterinarians showing horses at their show. You know, that maybe we can use those avenues and try to solve this issue. Does anyone have any questions?
Well, so this, these rules were made how many years ago? I think it was
1987 is the last year.
And so this is just process improvement. Yes. But you might change the rules so that process. Sometime or maybe the next meeting, I wouldn't mind having somebody bullet point the steps to changing a rule, a single rule, and how that happens. Because I've been here for 3 years and I still couldn't tell you, well, 4 years. I still couldn't tell you, and yet I was part of some of it, but not now.
And that's not we're gonna need about 25 slides, so we're not gonna do that.
Well, I'm serious, and I'm serious. We would think a rule needs to be changed. What happens then? It's a process.
It's a big deal.
And it is.
Well, and sometimes, sorry, there's the consideration of like, what kind of solutions can we find with that? They meet the existing regulations, but maybe help, you know, serve the stakeholders a little better while still, you know, serving our mission of, you know, it's our job to, you know, protect animal health at their interest, you know,
So, but I want the rules decided to be changed and not, oh, but maybe we can do this and maybe we can do that and all these other things can be done. What's the process? What's the process?
I think it'd be good to get you, just like you said, a bullet list of that, because we're gonna be going through that, and some of these rule changes will come before you, so you need to know when you step in
And including the rule that says board members can attend meetings but cannot talk. We can go to listening sessions like a task force, like, you know, or a task force meeting or something. We, as board members, as board of directors, as board of directors, we're supposed to stay out of it until the rule is up for voting on the change.
before you get one.
Yes, that's.
Or to do.
But, yeah.
So I do have a full chart. Especially me advised by Senator Department of Health and Attorney that they're approved. As a good jumping on point, so also not tell you, you know, that we're going to go through it separate.
There's so many new people.
Really, because it's so much fun.
I'm excited.
Just the question, Brian, you and I talked a little bit about this in the shift. Is there an opportunity to use the virtual visit? And we were talking about pigs at that point, but a CBI visit that could preemptively be done before the event of a show, that each owner were able to capture a CBI, if you will, prior to, so you reduce those, you know, potential impacts at the exhibition or whatever it might be. That's just a thought. I'm not asking for approval so much as a seed for consideration.
Yeah, I think that's what Dr. Damico is looking for and something we can throw out there at your listening session, because we're looking for new ideas like that. So, what does that look like? How does that apply? And we need input from veterinarians to say how that will work. So right now, as Heather said, there's a lot of miscommunication, misunderstanding about what's required. We're not asking a physical exam of each horse at the show. We want visual exams. You know, what's obviously going on here? Is there a snotty nose? Are there warts? You know, things that are easy to pick up. We don't need temperature checks and that kind of thing. So it's somewhere along the line, the veterinarians are under the impression that they need to be on site for the entirety of the show. So this is my hourly wage. It's going to cost me $3,000 for me to be there. And that's not what we're looking for. So, but we are looking for out of the box ideas. What can we do that still accomplishes our goal to maintain the health and safety of domestic species in the state without being a burden to this industry that's very, very active in Minnesota. So I appreciate those kinds of thoughts. Yes.
So the suggestion, you repeated, so we make sure we understand, was a certificate of veterinary inspection for every single horse attending an exhibition within so many days of the show. We're looking at the need for the veterinary.
Everybody has one of these, and you can do a virtual visit.
So Brad, you're trying to apply to that. Actually, Dr. Thompson started with CVIs with the swine industry. The idea being during, I think it was actually during COVID that this came out. We don't want a lot of people mingling in these barns. We want to keep biosecurity at top notch. So does it make more sense to send one individual in there, do a virtual examination, send that to the veterinarians? So be an employee of the veterinarians, send it to the veterinarians so they can evaluate the animals and write a certificate. So something similar to that is.
Exactly. And at another point, I don't want to get, but just as an example, and I'm just asking a question, is your campgrounds that promote their horseback riding, if they're there all weekend, are those under the same scrutiny?
It's not an organized group activity.
Although there might be more horses there than in that.
So interestingly, and I don't want to go on a tangent, but, so there are endurance rides that go on, and those are organized, so they require a permit because they're all, it's the same thing, they're at the campground, but it's an organized ride. And there's somebody in charge of that's running that ride, right? But there are also people at the campground that maybe aren't in that ride that aren't part of the permit. But I found out, I didn't realize that the Department of Health requires a permit for a group camping together. Because, yeah, you didn't know that? I didn't know that either. That these rides also, because people camp together, they have to get a permit to do that as humans. So, you know.
So what's your definition of a group for camping, for example?
Well, this is my area. You have to get called up when someone's sick. Sure. I can't imagine that's enforced.
Yeah.
But I do have a comment, as I am one of the official state fair veterinarians, as you heard earlier. And at the state fair for, I don't do horses, but the other species, the CBI has to be within 90 days of the state fair. And that's to accommodate all the county fairs along the way. So when we find stuff, it's acute, you know, like it didn't maybe exist 90 days ago. So you have to be really concerned about about the number of days before the show for your idea.
And I think that's why there's the daily visual as well, because, you know, when we do an inspection, that's a point in time. You know, they still after that, but.
Any other questions?
I'm just gonna say thank you to all of the senior veterinarians, the field veterinarians, the staff. I'm really impressed with the Minnesota Board of Animal Health. Really.
I have appreciated everybody's respect of our timeline, and Erin is behind all of that, in prepping everybody, so thank you to Erin.
You're welcome.
The next thing on our agenda is to set our next meeting date before we adjourn, and then it sounds like there's a tour after this. Yes. So generally, our next meeting is in December. Wednesdays, okay for everybody? 6. Steve?
It's fine.
Al?
Good.
December 6th? Okay. Should we just keep in communication about this location?
Unless somebody has a suggestion, we can just discuss it later.
I do, I mean, we can talk later, but I do have a few ideas.
All right, great.
We can talk. Okay, is there a motion to adjourn the meeting?
So.
Is there a second?
Second.
All in favor, say aye.
Aye.
Opposed, same sign. Motion carries.